Welcome to this episode. I'm about to have a conversation with one of the most respected pediatrician in the city, and he is Dr. Anil Shetty. I'm at his beautiful residence, and you can see these beautiful paintings here made by his mother. This episode is especially made for modern young parents out there who is navigating a beautiful chaos of raising children. So my hope is that this conversation of us would give you clear, thoughtful mental models for your child's health and development. But this is more than just a parenting guide. If you are a medical student considering taking up pediatrics for your further studies, you will find a tremendous value here too. Dr. Anil Shetty is not only a brilliant doctor, he is also a professional quizzer and quizmaster. That is something we share in common. And one of the interesting things I found while browsing a patient review, I came across a line that really stayed with me, and it said, "The best doctor gives the least medicines." Okay, let's find out what that truly means. Thank you so much for your time.
Thank you, Clinton.
Ready for it?
Yes.
Yes, let's go. Since you are a seasoned quizzer and also a pediatrician, we can kick this conversation with fascinating or little known facts about children's health or development that would surprise most people.
How tall are you?
5'11".
5'11". Okay, so when do you think you are half your adult height? So you are 5'11" now.
Mm-hmm.
That'd be close to 178 centimeters, 177, 178.
Mm-hmm.
So when do you think you are half your adult height? So since you said I'm a quizzer,
Right.
I'll bounce that question back to you.
Right.
So roughly, when do you think you are half your adult height?
At the age of 10, 9 or 10.
Okay, 9 or 10. And now this...
No. Okay. No.
So you're calculating now.
Yeah. 8. 7, 8.
7, 8. Mm-hmm. So the answer will really surprise you.
Mm-hmm.
You are half your adult height at the age of 2. At the age of 2 years,
okay,
you would be half your adult height. Okay, people don't realize.
Can you elaborate that?
Yes,
okay.
I'll elaborate. Mm-hmm. See, what we should realize is that most of the growth takes place early. Okay, so a child who's 50 centimeters birth, if it's a term child, it'll be around 50 centimeters at birth. That child, by the time he's 1 year old, is length. So at that point, we don't say height because the child can't stand. We say length. The child will be 75 centimeters. So he would have gained 25 centimeters. So then that is half of his, when he's born is 50, half of that is 25. So he would be 75. And the next 1 year, he'll gain half of what he's gained in the past 1 year. So another 12. So he'll be around 87, 87.5. And so his adult height would be around 175.
Wow.
So
I was half my height at the age of
most
2.
people would be roughly half their adult height at the age of 2. Similarly, now your weight. Your weight, see the weight when you're born, if you're a term child again, you would be 3 kgs. It'll be triple and you'll be 9 kgs at 1 year. So you would have tripled. You would have gained
in 1 year.
6 kgs in 1 year. But in the next 1 year, you won't gain another 6 kgs. You'll gain 1 or 2 kgs. Okay. Similarly, the head circumference. So that is very crucial for us. So we measure the head circumference at birth. So a term baby which is born at birth would be about 35 centimeters. Now, your adult head circumference will be around 57, 58. But out of that 57, 58, that is around 23 centimeters you gained, most of it will be in the first 1 year. You'll be around 47 at 1 year.
Oh, okay.
So most of the growth of the brain takes place in the first 1 year. That is why that period is very crucial. The early period, your early childhood is very crucial. So most of the growth, especially your brain growth, happens at that 1 year. See, even if you look at any other species, you look at any of your pets, say a dog, a kitten, within a few hours, maximum within a day, you can see that kitten scurrying around. The puppy running. Even a calf, if you're in a farm, you'll see the calf running around. But for a human baby, it takes nearly 12 to 13 months for that baby to walk. The reason is, because when all these animals are born, except humans are the only species who are different. When they're born, they're fully developed, especially the motor part. Now, the difference in humans is, you compare to any other species, the human brain is the most powerful brain. That is not because the brain is the biggest, but the cortical part of the brain is the biggest. And actually, there are more neurons when you are born than when you are an adult.
Oh, interesting.
So those neurons, some of those neurons utilized are wired together and all that. So at birth,
They fuse.
the neurons will fuse together. So the reason, human concept, the baby is conceived and by 9 months you deliver. The reason
For?
now if you look at the most difficult birth takes place in humans.
What do you mean by difficult?
The most difficult because
9 months gestation,
not
and
because
painful delivery.
the risk to the baby and the risk to the mother is the highest in our species.
Interesting.
The reason is the size of the pelvis. Now humans are bipedal.
Bipedal.
We walk. There are our closest genetic cousins who are also bipedal, like the apes, the chimpanzees, and all that. But they don't walk erect.
Right.
They don't walk erect like that. They still walk like that. Now, even a chimp will start walking much earlier than a human. It won't walk immediately, unlike other animals, but it will walk
comparatively to humans
much earlier. And not only that chimp, as soon as it's little while after it's born, it will straddle onto its mother by holding on the fur of the mother, by gripping onto the fur of the mother. So the mother will carry the baby around it, because even though chimps can be bipedal, they most of the times they crawl either on the back or on the chest. It'll be holding onto the fur of the mother, and then human babies can't do that. Okay, so our growth, the growth of the young ones in our species, it takes the longest. We mature, our period of maturity is over 18 years, or 17 years, 18 years. No other species have that period of maturity. Because if a baby is to be born fully, imagine this baby has to be born fully developed, and then it will walk.
In the womb only it is fully developed.
Yeah, in the womb only it's fully developed. That can't happen because the size of the brain. The skull will be much bigger. This is all part of evolution.
Wow.
This is part of evolution. So the baby, when it's born, if you see, compared to other species, the baby skull is very mushy. We have so many sutures, soft, mushy compared to the other beings. When we became Homo erectus and then Homo sapiens, and we started walking erect, the advantages with walking erect is your arms are free. You can do so many other things with your arms, which all quadrupedal animals can't do.
Right.
So the advantage with that, the disadvantage with that is the pelvis becomes smaller. Because you're walking, the pelvis becomes smaller. So now for the baby to be born through that pelvis, see, there is a disproportion between the baby skull and this. So the human baby has to be born earlier, mature-wise, compared to all other species.
Right.
All other species.
Right.
Because there is a lot of brain growth yet to be achieved.
Correct.
So that is why the human species, the babies are delivered much early. So that there is a lot of growth to occur. If that had to occur earlier, then you can't deliver, because there's a narrow pelvis.
Right.
You can't deliver that baby.
It's like a body intelligence.
Body intelligence. It's evolution. It is evolution.
It's beautiful, right?
It is evolution has evolution has done that. And if you see again, babies when they're born, humans and maybe other primates are the only species where the baby is born in the opposite direction of the mother.
Can you repeat?
The baby is born
okay,
in the opposite direction of the mother.
What does that mean?
So suppose the mother is erect. The baby will be in the opposite direction.
Okay.
The baby's head will come out to the pelvis. The baby's head, not the legs. So it is not in the same direction. So the head will come out to the pelvis.
The reason being?
Once your head passes through, then your shoulders.
Right.
Your shoulders have to pass through the pelvis. So that doesn't hold for all deliveries. Of course, there are breech deliveries and all that. Right. But most of the deliveries is anterior-occipital. So it has to go through this. And then we have to maneuver the child and remove the child. Okay. So other than primates, nobody delivers that. If you see in a calf or a pep, the head doesn't come out first. Only in humans.
Legs come out first.
The legs come out first. The legs come out first. So in most of our deliveries, the head comes out first.
Again, what is the reason? I couldn't get the reason. Reason being?
The reason being, this is also part of evolution.
Okay.
The reason, see, now we humans are very social.
What is the advantage of egg coming first into to our species?
Otherwise, it will be difficult for the baby to come out of the pelvis. Unless we maneuver the shoulders and unless we achieve rotation. Once you grip the head, you can rotate the baby more easily.
Oh.
And unlike other species, we are social beings. See, if your leg comes out, then you don't need anyone else to to help you deliver the baby. Whereas in humans, we need the help of someone. Usually, you need the help of someone to deliver the baby. Correct. Of course, it can be done, but most times we need the help of someone to deliver the baby. So after the baby is born, then the maturity takes place. And unlike all other species, we don't start walking till 12 to 13 months. And even after that, the childhood, that period of childhood when you're still maturing, that is the longest in humans. No other species or that pediatric age group, that is the longest in humans.
Even our lifespan is long. That's why. Is it because of that?
Yeah, our lifespan. No, see, the thing with evolution is, the bigger you are, the longer you live.
Right.
If you see, the bigger the animal is, the longer it lives. Generally, except of course the tortoise, of course the turtles and the tortoise. Generally, because that is because of its slow metabolism. So elephants live long. But another interesting aspect in humans is, all other species except humans again are fertile. That is, they can conceive and deliver babies throughout their lifetime. Human beings are the only species who survive for much longer after our the period of fertility ceases. Even then, it continues.
Again, you trace that back to evolutionary advantage.
It is. See, now
grandparent.
It is called the grandmother effect. It has got a name. It is called the grandmother effect.
It eases the mother's parental responsibilities.
Yes. So deliveries are more successful when there is a grandmother around. Bringing up a child is more easier when there is a grandmother around.
Knowledge transfer
to the mother, to the baby. That is only seen in humans. In no other species will you see that. And that effect itself is called the grandmother effect. So this is all these are part of evolution. There are very few species who can do this. Okay.
Opposing.
Yeah. So we humans have an opposable thumb. And that opposable thumb is due to a muscle called the opponent's pollicis. Okay.
For the same reason we have the name primates, no?
Now primates can do this. They also can have opposable thumbs. But if you look at primates, the difference is the thumb in primates isn't as long as humans. What they can do is maximum 1 or 2 fingers. They can't do beyond that. They can't do opposable thing. Human being compared to primates, we have a much longer thumb. And we can do it for every finger. And that is primarily because of a muscle called the opponent's pollicis. And our civilization owes a lot to that one muscle. And our ability to have an opposable thumb. Because without that, see, when we deal with the milestones, development children, one of the most important milestones for us while we are assessing a child is the pincer grasp. So children have a ulnar grasp or a radial grasp. Now, around the age of 9 months, this becomes prominent, the pincer grasp.
All 5 fingers?
Yeah, they are able to hold objects.
Okay.
They are able to hold objects like that.
Can they connect every finger to the thumb?
Not necessarily, but they'll be able to, at least with the first 2 fingers, they'll be able to, because it's not a fully
grasp.
Mature, it's not a mature pincer grasp, but they'll be able to do this.
At the age of 9?
At the age of 9 months, roughly at the age of 9 months, give and take. So that is very crucial. So to turn pages, to do things. So with this, we are able to manipulate things. We are able to write. We are able to tie shoelaces, button your shirts. We are able to build devices, dials, all that. All that is because of that one muscle and our ability to do this.
Wow.
So evolution, it is all evolution. Evolution has blessed our species,
Yeah.
If you see the species before human beings who ruled the world, they were all huge animals. Like the dinosaurs, the mammoths.
Back then.
Back then, the dinosaurs. So the bigger your size, the more you're going to dominate your territory. And everybody, during evolution, everybody was, worried about the bigger species. The animals used to be worried about looking at the size of the dinosaurs, or probably the mammoth or the lion or the tiger. They used to be worried looking at the size of the species. And everyone used to avoid those bigger animals. When the proto-humans, our ancestors first arose and, they came, nobody was scared of them. I mean, we were comparatively puny compared to all the others. But we had one major advantage, which none of these other people had, especially Homo sapiens.
Brain size?
No, the ability to tell stories.
Communicate.
The ability to communicate. The ability to get together.
Social
and
bonding.
Social. The ability to work in
Groups.
And that is why we are the predominant species in the world.
And that's why we are having this podcast.
Yeah, we are having the podcast, which wouldn't have been possible.
Right. So what do you think a caveman would be confused by in today's parenting culture? If caveman would come by a time machine and look at modern parenting.
Now, unfortunately, a lot of parenting is digital. Now you want to appease a child, or you're busy. You want to concentrate on something else, or in fact, you want to make a child. Want to coax a child
something.
Coax a child to eat.
Right.
They show them some digital device
and feed something.
And then feed something. And without the help of that digital device, the child won't feed.
They're stimulated visually.
Which is actually not a very good thing to do.
Brain gets used to it. Brain gets wired to stimulation.
Below 18 months,
no screens.
That would be one thing.
One stupidity.
Yeah, one stupidity.
This is your 20th year practicing pediatrics?
This would be my 20 as a pediatrician. This would be my 22nd year.
22nd year.
Yeah,
okay.
22 years as a pediatrician.
Nice. So, what are the most common fears parents have? So we can get into the heads of new parents.
Yes.
So, what are the top 3 things parents constantly worry about, but probably don't need to?
Don't need to worry. Okay, one problem probably because of external influence more than anything, they feel that the child is not gaining enough weight.
Not gaining enough weight.
Because there is this thing of comparison. Especially when the child, passes beyond the age of 1 year. They have this fear that my child was feeding well and my child was gaining weight rapidly. Suddenly after the age of 1 year, he's stopped gaining weight and he's become fussy. He used to eat everything early. Earlier he used to eat everything, but now suddenly he's become fussy. He's not eating.
Picky eating.
See, that period, it's a natural phenomenon. It is called physiological anorexia. Because that has to happen. So basically your child, now he was not walking. Till the age of 12, 13 months, he was not walking. He was just lying around. And there is no other distraction.
Just eating.
And most importantly, I told you, the maximum period of growth is in the first 1 year.
Right.
So you need to feed more. You need to eat, consume more because your growth is rapid.
Correct.
So from 50 to 75 centimeters, your weight has gone tripled. Your head circumference has gone up by 12 centimeters.
Right.
So that is a period of rapid growth.
That's why they eat more.
That is why you need more calories. That is why you need more calories. That is why you need to consume more. But that doesn't hold true after the age of 1 year.
Because then they're feeding less.
Yeah, your growth is not as rapid.
Right.
Because your growth can't be that rapid. You can't. The same child who has gained 6 kgs in the first 1 year can't gain another 6 kgs in the second year. The growth won't be at the same pace. Now suddenly you have other distractions because you're ambulant. You're moving around. So you are interested in other things. Your mind is developing. You're observing other things. You're easily distracted, and all that baby fat with the baby hat, that fat in babies is different from the fat you see in adults. Adults is what we call as white fat. The fat you see in babies is brown fat.
Interesting.
So the brown fat is mainly to protect the baby from cold. From cold. It's thermoregulation. So basically the brown fat is present in the baby to protect the baby from,
external environment
and all that. So whenever the body senses hypothermia, it releases signals to the brown fat to release fatty acids, and it'll help in
insulate.
It'll help in combating the hypothermia. As you that brown fat has to be replaced by muscle. If that fat is not replaced by muscle, then you can't walk. Then you can't sit.
Correct.
You can't stand. So that baby has to go through the phase. That baby has to become lean. That baby has to have a decreased appetite. It has to reduce. So that is one fear.
Interesting.
One more fear.
So do they overfeed that at that time?
Yes.
Like they're not eating well. So you coax them and add more sugar and make it more palatable.
Yes. So that there's all this while they've been accustomed to the child eating well, and they've
suddenly
pictured the baby.
shift.
Yes, baby is chubby, and everybody's fond of chubby babies.
Right.
With chubby cheeks, and suddenly the baby starts becoming lean. They start worrying, and they tend to overcompensate. They try to feed the child as much as they were feeding earlier, or probably in proportion to.
Is that dangerous? Is that wrong? I mean, would that lead to any complication, overfeeding?
Yeah, that would lead to childhood obesity. That would lead to the sort of revulsion for food. Would lead to other problems much later.
Do you see these conditions, childhood obesity, frequent these days?
Yeah, nowadays childhood obesity is a problem, especially if you're giving a lot of sugary foods. Sugary foods, that is a problem.
And overfeeding.
That
childhood obesity you trace back to this parental behavior rather than genetics.
No, there are multiple factors, and one of the factors we consider is how much the parents are feeding, how much that, and especially what kind of food they're giving. If it's sugar, because
high calorie.
People think that giving jaggery is a good substitute to sugar. Actually,
it's the same thing.
Jaggery is probably worse.
Yeah?
Jaggery has a higher glycemic index than sugar. Jaggery is probably, even more dangerous than sugar. Jaggery has a higher glycemic index.
That's the biggest fad in consumer food market also.
Yes. Even health foods.
No sugar, only jaggery.
See, now what they say is, why jaggery is better? Because they say, now the minute you say jaggery has a higher glycemic index than sugar, they say jaggery contains more iron, more vitamins. But for you to get the benefit of that iron and that vitamins, the amount of jaggery you'll have to take is enormous. With that small amount of jaggery, you're not giving any extra nutrients to the child. There is no benefit in giving this.
So that is the biggest myth, actually.
Yeah.
Like present day, they say jaggery is better than sugar.
No,
it's the same thing.
It isn't. Not only for children, for adults also. For adults also. Because to get the nutritional benefit of jaggery, you will have to consume an enormous amount of jaggery.
Right.
And you're using jaggery as a substitute for sugar. So the amount of jaggery you're using is very little.
Right.
And jaggery is as dangerous, probably more dangerers than
sugar.
Right. Even honey. They give small amounts of honey to a small child. A lot of people have this practice of giving honey.
Okay.
Even one drop of honey. They say it doesn't matter, just one drop, 1 spoon of honey. But honey is very dangerous.
How so?
See, honey is one of the most common causes of botulism. Now, botulism is a toxin.
Right. Very dangerous toxin.
Very dangerous.
1 kg of botulism can wipe out entire population on Earth,
the entire population of the city.
Right.
It can wipe out the population. So, the risk of botulism poisoning with even one drop of honey is prudent. So, ideally, you should give honey after the age of 2 years, when the baby's gut is more mature, when it can handle all this.
After 2 years. Honey only after 2 years.
Honey is after 2 years, not before 2 years.
Why do they feed honey? Thinking that is
No, I think it's probably part of a custom and practice. Many communities have that, of giving 1 drop of honey, or they assume that honey is, honey is good for the baby.
Health benefits.
It isn't.
Okay.
It is, in fact, on the contrary, it's very dangerous.
Okay.
Giving honey is dangerous to baby below the age of 2 years.
So we were talking about the worry. So one of the biggest worry parents have is they think they're not eating as much as they used to.
Yes.
So that is one.
Yeah.
So that worry leads to many other problems, like overfeeding, childhood obesity. So any other worries?
The other worry is now the child is 3 or 4 years old. Then parents they come to you and they suddenly feel that suddenly my child, depending upon whether it's 3 or 4 years or 5 or 6 years old, that my child was healthy all the time. Now he falls sick much more often. He is falling sick more frequently.
After 4 years.
Or after 6 years, whatever may be the case. Suddenly the bouts of illness or sickness, that is increased dramatically. But that is because what they don't realize is, the first thing I ask them is he going to any play school? Is he going to any school? Because the minute you enroll your child in a school, or you enroll your child in a play school, because earlier it was only schools, 5 or 6 years. Now, play school, kindergarten, Montessori, 1, 2, 3. You put those children there. Suddenly they're exposed to other children. So now, either they were single children, so they were not exposed to other children, or only to this.
Suddenly there are so many present.
Only to this. Yes. Suddenly you go to an environment where there are so many other children. And what happens? These children are all coughing. They have infections. So they are given to each other, which is not necessarily not a bad thing.
Herd immunity,
which is not a bad thing. There's nothing wrong with that.
Your body is training for the immunity.
That is how you develop immunity. Imagine a child who was homeschooled. Okay. you didn't send him to school first standard, second standard, you don't send him to school. Yes, no. That child comparatively won't fall sick that much. But you start sending him to school at, say, third standard. Then the child will fall sick repeatedly. Because compared to the other children in his class, his immunity is lower.
Interesting.
So don't worry when you first send your child to school. That's a natural phenomenon. They will fall sick repeatedly. They will be catching infection from other babies, and they will also be giving infections to other babies.
And that's a good thing.
That is not a bad thing. It is not a bad thing.
Yeah, body is getting trained for to fight things.
Immunity.
Right.
And see, there's a major difference between a child's immunity and an adult's immunity. So remember the pandemic?
Right.
So we're all worried about COVID. All of us were worried about COVID. COVID did affect children. COVID affected children. And of course, we had a lot of children, unfortunately, dying. There was mortality in children. But when you compare children, adult and children, especially elderly, even adults and children, the risks were much lower in children. The risk is comparatively much lower in a child. Because there's a difference in immunity between a child and an adult. Now I told you go to school. You are exposed to more and more infections. So your body learning how to deal with those infections, correct? So your body knows how to deal with new infections. As you grow older, the chances of you encountering a new infection is very less. So most of the infections you encounter are repeat infections, something you have encountered during your childhood. And your body knows how to deal with them. Your body is adapted at dealing with them.
Body has a memory of...
yes, body has a memory, exactly. Body has a memory of how to deal with that infection. So it recognizes that infection immediately. I have dealt with this previously, and this is how I'm going to deal with it. But it has been not exposed to new infection in a long time. So suddenly, COVID was a new organism. It's a new virus. For a child, it is just another virus.
New organism.
And just another infection. So the child's immunity, which is adapted at dealing with the new infections, for that, this is just another new infection. I'm basically simplifying things. But that is why children were not as affected as adults. See, from the minute you are born, you're bombarded with organisms every day.
Right.
And your body learns to deal with those organisms. So COVID is just a new organism. Your body is very good at dealing with new organisms in a child. In an adult, your body is good at dealing with repeat infections.
Suddenly, new organism overstimulates.
So basically what happened was our immunity tends to overreact, cytokine storm. And then when your immunity overreacts, that is when the problem occurred. So even when schools were closed during the pandemic, one of the main reasons is not just to protect the children. One of the major concerns was adults will be affected. So we were closing schools not just to protect children, but to protect the adults, especially the elderly, the ones with comorbid infections.
Correct.
That is the main reason we're closing.
Yes. Any other myths you want to burst? There are a lot of myths, like massage, giving massage.
See, there's nothing wrong with giving massage, but giving a massage necessarily doesn't make your body, stronger or more. Probably a coconut oil would probably help a little, but not much. There's, sometimes as soon as the baby is born, they give a bath. Not necessary. What is primary is that the baby is warm. Giving a bath immediately to the baby is not that important to us. And, applying those kajal to the eyes, lot of kajal, that isn't
Cultural
good.
problem.
Cultural problem. That isn't good. That's a risk of there's a risk of eye infection. Massaging, some communities have this practice of using mustard oil. That is very bad. It's an irritant. Coconut, probably I can understand it. But giving massages, that is not of, this is all this fads that I have started with your nannies, the ones who look after those babies. So they have all this customs. They have this very bad practice of, inserting the finger into the mouth of the baby.
Why?
So, and then they stimulate the baby's throat. And obviously the baby will regurgitate something out, and then they kapha, infection. Which is, highly dangerous. Please don't let, they have this specialized nannies who come to your house. And I think it's 39 days for girls. If it's a girl, female baby, and 40 days for a male baby. They come and stay with you. And they charge you a king's ransom for looking after the baby. And they do stuff like this, putting their finger into the mouth and then coaxing, provoking the baby into cough and saying that it's kapha. So all those are very dangerous practices.
Any other practices that you want to debunk or
Okay, they giving milk early. Not
Breast
required.
milk.
Cow's milk. No, not breast milk. Breast milk is
Absolutely. And that is another thing. Like they give bottled milk.
People think that we pediatricians keep on harping about breastfeeding, because but that is,
that's how you build immunity.
See, milk is species specific.
Right. And we are the only species drinking other species milk.
Yeah, we are the only species that drinks other species milk. And giving a cow's milk early, there's a huge difference between cow's milk and human milk. The protein content in cow's milk is different from the protein content in
human milk.
The carbohydrate content in human milk is lactose is more than the content in milk. So there's a huge difference. So these milks are usually species specific,
right?
And they give they transfer, they help you in immunity, they help in your gut maturity. There are a lot of advantages in giving
gut microbiome, right? That's really important.
Yeah, that is really important. So all that comes with the species specific milk,
correct?
Not with some other species.
What mistakes they make here particularly?
They introduce cow's milk early.
Early.
See, ideally what we say is breastfeeding up to 6 months, exclusive breastfeeding up to 6 months. You don't have to give anything. At least up till the age of 4 to 6 months, you don't have
anything.
Nothing is necessary.
Nothing, just breast milk.
Yeah. By the time the baby is 6 months, the breast milk production would have peaked. So beyond that point, the breast milk production won't increase.
Ceases.
Won't increase. So the maximum breast milk production would be about 600 ml.
600 ml per day?
Yeah, per day.
Wow.
Per day. So that will give about 500 calories. Okay. So that would be sufficient for a baby up till the age of, say, 6 months. But beyond that, you need to give other foods because breast milk won't be enough.
Right.
So then you have to give other foods.
After 6 months.
So until 6 months, other than breast milk, nothing else is required.
Parents give cow's milk before 6 months.
Sometimes before 6 months, even before 1 year, not necessary. Not necessary at all. And even not just cow's milk, starting weaning foods early, giving foods early, or sometimes on the other extreme, delaying the food.
Who is that careless parent?
The parents, because there are these customs that you shouldn't start feeding until the baby is a certain age, or giving rice at a certain age and all that. So the baby requests breast milk at 6 months of age is not sufficient to meet the baby's needs. That is when growth will start faltering if you don't give extra calories and weaning foods. That is when you have to give. And frequently while giving breast milk, they also give water because they think all of us require water. So babies also require water. But what they don't understand is that most of the content of your breast milk is water.
Yeah.
Almost 70%. 70%. It is water. So there is no need for giving the water in addition to breast milk. One more thing is giving bottle feeds. So breastfeeding it requires some effort.
Right.
The baby has to has to put some effort to feed, to suckle, and then to feed. The baby has to put some
exercise.
It's sort of an exercise. You substitute with the with the bottle feed. The minute the baby bites on the bottle,
effortless.
The nipple of the bottle, immediately milk is dispensed. The baby consumes it.
How does it affect?
The baby starts preferring bottle feed.
Bottle feed because
that is easier. The baby starts becoming lazy. Starts preferring that.
Laziness is our innate nature of all humans.
So, why would you want to put that effort when you can get it more easy?
So, if they prefer that, then there will be less bonding with the mother as well.
There's less bonding. That is one of the problems. And bottle feeding, you can't digest all those things at that age. So again, like I said, species specific. The breast milk is the most important component up until 6 years. And 6 months of age. So ideally, don't replace it with anything else.
Right.
At least. And then you continue breastfeeding. Once they start weaning, some people, especially of course, now modern day there are lots of pressures because the mother is working, mother has to go back to work. In that case, give express breast milk.
But there is one bottle, no? Like mother can extract her own breast milk in the bottle and
keep it in the refrigerator. You can do that.
Where do you stand on that? What do you have to say about that? That has helped a lot of working women out there.
Yeah, a lot of working women, you have to make compromise. So ideally what you should do is, see why breast milk is required. Even after 6 months, we advocate in fact, that they continue breastfeeding as long as possible. Or at least up till 2 years. Because breast milk is required for the myelination of the brain.
Means?
For the development of the brain, for the maturity of the brain.
Not How only does breastfeeding would help?
Because it helps in the myelination, the myelin connections between the brain, for a gut maturity, all that for immunity. So the mother is transferring all that, her innate immunity to the baby also. So all that is required. Innumerable studies that have shown that the longer you feed your child, breastfeed your child, or at least up to 2 years, the better the immunity in the child, the better the brain growth in the child, the better the performance in school-wise or otherwise in the child. So at least up till 2 years of age, ideally breastfeed the child.
Since we are talking about food, there's a lot of things to talk about food. I want to come to this one. We are constantly bombarded with advertisements for children's health products, from height increasing supplements and brain boosters like Complan, Bornvita, to immunity builders like Chyawanprash, various vitamin syrups to digestive aids like Horlicks. I mean, there's so many commercial products out there. Parents see these ads during cartoon shows, cricket matches, and across social media, often featuring celebrity endorsements and promises of making children taller, smarter, or stronger. These marketing campaigns are incredibly persuasive and prey on every parent's deepest insecurities.
Yes.
Is my child growing enough? Are they smart enough? Are they healthy enough? The emotional appeal is so strong that many parents feel guilty if they are not buying these products for their children. So what do you have to say about that?
Zero. There is no advantage.
No supplements required.
None of them. See, these are rich in sugar. That is why children, you're not doing anything except giving your baby a sugar rush. Otherwise, there is no advantage either in intellectually or developmentally or immunity-wise.
Height-wise. Biggest insecurity.
Yeah, height-wise.
Right.
See, height-wise, basically what is height-wise? Height-wise is your genetic potential.
Right. Growth hormones.
Yeah, see, weight, okay. Weight is mainly what you consume and that has some bearing. But height ultimately it's of course a lot to do with nutrition, but also your genetic potential. If your parents, if your mother and father are of a certain height, then obviously the progeny also will be a certain height only.
Right.
So when we calculate the expected height, we have a formula. So it's called the mid-parental height. We take the father's height, the mother's height, and plus or minus so much for a male baby, and plus or minus so much for a female baby.
You combine them and do the...
Yeah, we have a formula. So we take the mother's height, the father's height, take the average, then plus or minus 15.
Interesting.
So then we look at it's a set formula so that we can calculate the expected height.
You can keep track on the developmental height wise.
So it's height is again, it depends a lot of it depends upon genetic potential.
Genetics.
If your parents are short,
right,
or one of the parents are short, you can't expect the child to be suddenly just because you're taking say Complan or some other Pediatrics or something, your child to gain height.
So no supplements required.
Not at all. I mean, if you want to give your children something to if you're giving it for the purpose of so that they can drink some milk, otherwise they're not that compliant, you can give it. But that won't give you any advantage.
Right.
Any advantage.
I was grown up with that fish cod oil.
Fish cod oil.
What do you think about that?
Fish cod oil, again, it's again, part of it is a myth, partly beneficial. Some vitamins you might get from it, but not a big fan of that. So
any advice on the nutrition part? Like what is preferential to give or what is good to give? Fiber content, such things. Okay, so ideally your perfect diet would be up till the age of 6 months, like I said, breast milk. It should be exclusive breastfeeding. After that, you start feeding the child. After that, now the thing is you start with cereals. Okay, from breast milk to cereal. That's how you transition. No, breast milk you continue. You continue up to the age of 2 years or as long as you can. Exclusive breast milk up till 6 months. Exclusive. After 6 months, you start weaning giving foods. Compliments. Okay, so weaning is making the child accustomed to something, and basically you are giving cereals. So ideally, you should give cereals first. Like cereals like what is culturally prevalent in that area. Suppose our area, rice, ragi, wheat, whatever is it. There's no point in some other cereal which is not culturally prevalent. Right, it won't help much. So you make your child accustomed to this cereals. What is prevalent in that area. After giving cereals, monocereals, that is one cereal. Do pediatricians suggest quantity of how much to give, or do they have instinct to know how much to give? I think the best judges of that will be the parents. Better than that, they will this. So when you're breastfeeding, continuing breastfeeding, this should be in addition to the breastfeeding. This should be in addition to the breastfeeding. Okay, so when you give cereals, initially you start with 1 to 2 spoons, and then gradually graduate to cup. So you start with mono cereals, then you go to multi cereals, that is more than one cereal, like ragi and rice, and then you go to pulses.
So because you have to give both pulses, a little later wise you have to give both pulses and cereals, because the cereals, and when you give cereals to pulses, one of them lacks methionine, one of them lacks lysine. Okay,
amino acids.
So basically we in our bodies we have something called as non-essential amino acid and essential amino acid.
Correct.
So non-essential amino acids are the one the body produces. So it is not essential because your body itself is producing. And essential amino acids are the ones which the body doesn't produce.
Outside.
You have to get from external sources. So those amino acids have to be provided. So an ideal diet would be, say, 55 to 60% carbohydrates. Then
cereals.
Yeah.
Those are provided by cereals.
Cereals, pulses, all that. Milk, even sugar.
Right.
Those are all carbohydrates. Starch, complex starch. Fiber. Now carbohydrates provide fiber. Now fiber is very useful. It helps in retaining the water content, helps in digesting.
Yes.
One more thing that is very common in children is fishes. Adults, we have fishes later, but in children is much more common. But the advantage,
what is
fishes? Anal fishes. Anal fishes. So when your stools are tight, it can rip open and you can have anal fishes.
Oh, is it?
Just like in adults, but children is more frequent. But the thing is, it heals faster in children. So fishes are also a common problem
because of
lack of fiber.
Lack of fiber, right?
If your diet is not, most of the problems, this constipation and these problems is because of a lack of fiber. If your diet doesn't contain enough fiber, fibers are again in carbohydrates, cereals, in your green leafy vegetables, even oats has fibers, leafy vegetables, green color. If you give a fruit like an apple, the apple won't have fiber, but the skin will have. So your ideal diet should have carbohydrates, 60%, around 55 to 60%, 30% fats. These are to provide the energy. These provide the energy.
Right. And insulation and
the energy. The 15% proteins, they are the ones that promote growth. They are the bodybuilders. You need that. And for protection, you need minerals, you need vitamins. Then you need water.
Okay, you have given nice principles to think about the nutrition and the balanced diet. So, yeah, we can continue that chart till they become adolescents. Like we covered from 6 months to next, the transition is cereals. What next?
By the age when the child is 1 year, the child should be able to eat. It's your family pot. Whatever the family is eating, the child should be able to eat. And can eat whatever you are eating. By the age of 1 year, not much longer. At the age of 1 year, except that you'll have to reduce the spice a little, probably salt a little, less sugar. Otherwise, the child should consume everything that you are eating by that 1 year.
Meat also, fish also.
Definitely. These are all proteins.
And one of the biggest complaint parents have is my child doesn't eat vegetables or something like that. So, what they can do about it?
See, the best way to deal with this is when the child is young, introduce them and make sure that the child takes them. Because the older the child is and the older you start trying to introduce them, the more resistant the child is going to be. You suddenly start giving something much later, the child is not going to do this.
Okay, let's talk about that vegetables. So how can they feed the vegetables to a 8-month-old baby?
At that age, 8 months. So basically what happens is, now the 6 months is when the gums become harder. So even though the teething has not erupted, the gums are harder and it's preparing for teething. So generally your first teeth erupts at the age of 6 months. And then what we say is 1 teeth every month. So if the child is 18 months, so 18 minus 6. So the child should have roughly 12 teeth. But that may not always be the case. And even if there is no teething that has erupted, don't worry.
They can still eat.
They can wait. There is no problem with it. Teething can erupt as late as 13, 14 months also can erupt. So that is not an issue. So once the gums become harder, the child can, start biting on it. So by the time it's 8 or 9 months, you can give vegetables by, making puree and diluting this. The child may not be able to consume the hard itself. Give purees. And then if you're giving proteins through, say, your chapati, then you soften it with milk. And then the gums are hard enough, the child can start chewing at 9 months. And then they can digest the food. So by the time the teeth erupt, the child can chew on harder foods, and then they can take the food. So but the best probably way is to introduce this vegetables as purees only. This is another thing, that another practice. Babies should be fed on demand. some parents who think that the baby have to be fed 6 to 8 times a day or a certain number of days or every 2 hours, every 1.5 hours, every 3 hours.
Timetable.
Every 3 hours by the clock. Imagine you're sleeping and they wake you up every 1.5 hours and tell you to feed. We won't be hungry.
Right.
Will be the same thing with the baby. So it's called on-demand feeding. The baby, how will it let you know that he's hungry? He or she is hungry by crying. When the baby cries, it's usually due to because of hunger. That is when you have to feed the baby. Only then. Not wake up the baby and try to feed it every.
That's the biggest mistake.
Biggest mistake. If the baby is sleeping comfortably, that means the baby is not hungry. And you can't have one size fits all. Some babies might be different from others. Some babies might need 5 to 6 feeds a day. Some babies might need 8 to 10 feeds a day. So now again, babies, like I said, babies are very grumpy. So they start crying on demand. You don't feed them on time, then they become very agitated. Then you start giving the feeds, they'll refuse. They're short-tempered.
So how to handle such situation if mother forgot to give or with other circumstances?
Do better next time. On demand. Learn your lesson.
Right.
Learn your lesson and do this. Probably you'll have to coax with this. See, the thing even with babies, what people don't realize is babies also have emotions. This emotional. How we measure intelligence, IQ, we measure developmental quotients, DQ, and we also measure EQ,
right?
Emotional quotient. So babies, you go to a postnatal ward, baby ward, or you go to a nursery, and then you see one baby crying. Immediately, all the babies will start crying. Immediately, all the babies crying.
Just like yawning.
Yeah, just like yawning. No, this is babies actually. They're expressing the solidarity with each other. This is actually true. They actually expressing the solidarity with each other. To prove this, what they've done is they've played tapes of the same baby crying to the baby. The baby won't cry because it recognizes that it is.
Can you repeat?
So they played tapes of the same baby crying, and the baby won't.
In the ward,
In the ward, the experimental. Where we play the tapes of the same baby crying. You tape the baby crying and play the tape back. They won't cry. But you play the tape of another baby crying, immediately they start bawling. So they're basically, sort of expressing their solidarity because they're sort of, empathizing with each other. You see, even at birth, for example, girls and boys, when the way girls develop is slightly different from the way, people say, about even toys, they say gender stereotyping and this.
That bullshit.
Gender stereotyping. You can't you let boys play with dolls. There's no harm in boys playing with dolls, except it. But generally, girls will gravitate towards dolls and boys will gravitate towards action figures.
Correct.
That is inherent. It's sort of like built in them. See, for example, the way a girl matures is different from a boy maturing. When we measure development, we have 4 domains. The 4 domains are, one is gross motor, that is sitting, crawling, walking, all those big steps. Then fine motor. Fine motor is, buttoning a shirt, tying shoelaces, scribbling, writing, drawing circles. Those are fine motor. Then we have language. So the baby begins cooing, babbling, and then we, monosyllables, bisyllables, sentences, words, and all that. Then you have social, where the baby is waving bye-bye, playing those peekaboo, then smiling at the mother, stranger anxiety, playing with other kids. Those are all social. So we measure mainly by gross motor, fine motor, language, and social. Now, girls generally, they tend to mature faster in language and social. If you see in girls' vocabulary,
right,
it'll be better than a boy's
vocabulary. Even the older ones, the same.
Girls' vocabulary at a certain age,
they can express it
better.
Yes,
they can express better because the social and language milestones develop faster than boys. Boys generally tend to develop faster with their motor milestones. Okay, this is inherent. Evolutionary. See, even not only in humans, they've done this in chimps, where the girl, generally a girl baby, will look at the mother for a longer time. Study the mother, look at the mother's face, and face regard, look at the mother for a longer time.
Social bonding?
Yeah, observe the mother for a longer time. Boys on the 10 small babies, I'm talking about newborns, they're generally more distracted. They look at the mother and then they're more, curious about the other things. So there's subtle difference between language.
What does that interpret as? Like that behavior? What does that say?
Again, the same thing I said. The social development in girls generally tends to be faster than boys. And boys, maybe motor skills will be faster than boys.
Interesting.
See the same similarly. You see, suppose let's talk about 3-year-old. Let's assume that the 3-year-old girl and there's a 3-year-old boy. They see one baby crying. Okay. You know what this 3-year-old girl will do? She will search for a mother. Her mother, not someone else's mother, her mother. Then she will drag her mother to that baby, assuming that a mother can console anyone. So she will drag a mother.
Wow.
Now a 3-year-old boy, he look at the baby, he might have some sympathy, but generally these boys will tend to ignore that girl, baby. Because so that, the social development, there's subtle differences. In the end, they all catch up.
Which is all evolutionary.
All evolutionary.
Right.
The same. That nurturing, all this, they're more in the female of the species. Not only in human beings, but these are all evolutionary.
Right.
Inherent, inbuilt. So that is about the...
Yes. So we'll move on to boosting immunity. There's this intense obsession among parents today about boosting their child's immunity. Every time a child gets a cold or fever, parents immediately think weak immunity and start researching supplements. During flu season or post-COVID, this anxiety has reached new heights. Parents are almost competing over whose child gets sick less often, as if it's a report card on their parenting. My child isn't fallen sick in 6 months becomes a bragging point, while my toddler has been 3 colds this winter feels like a parental failure. Help us understand what is actually happening in child's immune system as it develops. I think we have dealt with this, but is the concept of boosting immunity through commercial supplement, is it even a scientifically valid point?
No. There is, not the best way to, your child's immunity will improve is either by, active immunity, which is getting the disease itself, or by through a vaccine. Now, those are the only two things that will actually benefit your immunity.
Right.
Taking supplements may not be. Maybe
there are commercial supplements.
So for example, now suppose you take citrus fruits. So there's a lot of vitamin C in this. So there is evidence to show that vitamin C helps prevent or at least elevate the symptoms of cold and reduce the incidence of cold. So those might be benefit, but those are all present in natural food.
Right.
So a good diet, vaccination is the best remedy for all this. There is no added advantage or no benefit. You're just wasting money by giving.
And how about playing in mud? Does that boost immunity? Playing in mud, playing outside, playing in the garden.
Basically, sometimes when you play in mud, and there are kids who even eat mud. Okay, so that is called pica. Eating non-edible substances. So we frequently encounter that in children who have iron deficiency anemia. Okay, so they start eating even peeling of the paint from this. They start eating
putting it in the mouth.
Putting in the mouth. So many of those paints, as you know, will contain lead.
Right.
So that itself can also cause iron deficiency anemia and cause lead poisoning. But generally playing with mud or especially in farms, children have grown up, playing with grass, falling down. Otherwise, there shouldn't be any constraints to playing with that. It is not that it'll harm your child or anything. But if there is a risk of infection, probably hookworm and all that, if you're barefoot and all that. But otherwise, there is no contraindication for playing. Actually, what we need is we need children to play more.
Yeah, that's
outdoors.
That has reduced a lot.
That is basically disappeared.
Yeah, kids don't play in the mud. And also, mud is considered something
rolling
dirty
in the mud and getting small bruises. Perfectly normal. That is part and parcel of childhood.
Right.
You let your children in the parks, let them play with each other.
And most of the time, children cry because of this own looking at the parental reaction rather than the actual pain, right?
Yes. There's an ode to children from Khalil Gibran.
Okay.
The Lebanese poet. So he says, you are the boss. That is the parents. You are the boss from which your children as living arrows are sent forth. You are the boss from which your children as living arrows are sent forth. So basically what he's saying is, you are the boss. And just like how the arrow can't be tethered to the bow forever, you have to let go. The only thing what you have to do is, you have to give guidance and direction to your child so that it can soar. Okay.
Interesting.
And basically that is what. And it says, the archer sees the mark upon the infinite. So basically, when he says the archer, he's talking about what, if you want to say, an higher force, maybe God or maybe life. So the archer sees the mark upon the infinite, upon the path of the infinite. So basically, we don't know what a child's destiny is. A child could be destined for so many things, but we can't try to control it, try to force it into the child. We should let the child go along the path, And finally, he says, just as he loves the arrow that flies, he also loves the bow that is steady. So basically what he's saying is, you let your children go, but what you need to be is, you need to be steady, strong and supportive. And that is what a bow is. And that is what you have to be. So we can't control the destiny of our children, but we can only guide them. Children are not a possessions. They're just souls to be guided into their destiny, and whatever the destiny may be.
So vaccination next.
Yes.
So vaccines have become one of the most emotionally charged topic in pediatric health today. On one side, we have an incredibly successful global vaccination program that has virtually eliminated diseases that killed once millions of children. On the other side, we have parents scrolling through social media at 2 a.m., reading conflicting information, watching testimonials, and falling into rabbit holes of doubt. What's particularly challenging is that many of today's parents have never seen polio, measles, or diphtheria, the very diseases vaccines prevent. When they are asked to give multiple shots to their healthy baby, some start questioning why so many vaccines so early. Are we overwhelming the tiny immune system? What about side effects I read about online? The fear feels more real than disease they have never witnessed. Then there's the timing anxiety. Parents worry about the vaccine schedule, wonder if they can space them out or delay certain vaccines. Meanwhile, grandparents often add their own confusion. We didn't have all these vaccines and we turned out fine. The tragedy is that hesitant parents aren't anti-science. They're actually trying to make the most informed decisions for their child. How do you navigate this conversation with worried parents?
Each of this.
Yes. You tell me the vaccine landscape.
First, they will deal with the elephant in the room.
Yes.
Which is the number of vaccines. If you see, most of the vaccines are given in the first 1 year of life. So
how many?
So at birth, you give 3 vaccines. You give
just right after birth.
Yeah, just after birth. You give your BCG. You give your hepatitis B, and you give polio vaccine, whole polio vaccine. And then at 6, 10, 14 weeks, you have your combination vaccines. You have your diphtheria, pertussis, tetanus. You have your hepatitis B and H influenza, and your injectable polio vaccine. All of them in one single shot, can be combined in one single shot.
That is a combination
vaccine. Okay. And either combination or IPV support. Then you have pneumococcal vaccines. And then you give 2 oral, that is polio, that's a drop, and you give a rotavirus vaccine. Rotavirus vaccine is rotavirus is a little more quantity that you have to give to the baby. And this is repeated again at 6 weeks or 1.5 months, 10 weeks or 2.5 months, and 14 weeks or 3.5 months. So you give that. So then again, there's so many vaccines. And then again, 9 months, you give your MMR.
MMR is?
Measles, mumps, and rubella.
Okay.
Measles, mumps, and rubella. Then you have your Japanese encephalitis vaccine, which is something that has been started just last.
This is roundworm?
No, Japanese encephalitis is it's an encephalitis. It's a sort of a brain infection.
Okay. Oh, encephalitis.
Okay, encephalitis. It is more traditionally seen more in parts of North Karnataka, northeast part of Karnataka, like Bellary. Gradually it is, but the mortality is very high. So now we have started giving the Japanese encephalitis vaccine also. And then,
so what does it do?
That protects against Japanese encephalitis. Japanese encephalitis.
What are the symptoms? How does it look?
Just like any other encephalitis. But the mortality with the encephalitis, Japanese encephalitis is more.
Very high.
So you'll have your fever, you might have convulsions. Mainly your brains are affected. Your brain is affected. So then there are additional vaccines. You can give 2 doses of influenza vaccine in the first 1 year. And then you can give typhoid vaccine, hepatitis C. So now when we're talking about this, we're talking about some 17, 20 vaccines. And like you said, parents may have that apprehension that so many vaccines, by the time my child is 1 year, we're giving so many vaccines. So 20 vaccines, 21 vaccines. And like you said, grandparents may say, we never had those vaccines. Correct. We never had those vaccines and we manage. But now you're giving 21 vaccines at that. By the child is this.
1 year.
Yeah. The best argument that is that those 21 vaccines are just a drop in the ocean. Just a drop in the ocean. Every day, every single day, every single hour, every single minute, every single second, your child is bombarded with organisms. He is exposed to, we are talking about vaccines. There are other things, the child is developing immunity too. By every day, by the air he breathes, by the food he ingests, through skin contact, he is being exposed to millions of organisms. So 21 vaccines is nothing but just a drop in the ocean. That isn't going to affect you. And why we give at a certain age? See, now there is a prescribed this. Because, for example, rotavirus. I said we give rotavirus
after 6 months.
No, we give it at 6 weeks, 10 weeks,
6
and 14,
weeks, okay.
10 full, ideally. But we don't give that in older children. Why we give that is, in the first 6 months of life, or even 1 year, the most common cause of diarrhea, around 40 to 50% causes of diarrhea, is rotavirus. So that has to be given early. And you give all these vaccines because you want to prevent the chances of that. When the child is, the immunity is peaking, that is when you want to give these vaccines. For example, measles. Now again, measles. Why do we give it in 9 months? We don't give it before 9 months because the mother's immunity is transferred to the baby. The mother's immunity against measles is transferred to the baby. And that will last up till 9 months. So at 9 months, the mother's immunity, which was transferred to the baby
through breastfeeding,
through birth itself, the process of birth itself, the immunity is transferred to the baby. That immunity fades away. So that is when you have to replace the immunity. And measles is probably one of the most successful vaccines ever given.
Right.
And this again, vaccines. See, when we're talking about vaccines, the disease that has killed the maximum number of people, more than probably any other organisms. And by far, the disease that has killed the maximum number of people is smallpox. No disease in the history of humankind has killed more people. And
humanity is one of the biggest inventions in healthcare is eradicating smallpox.
The two greatest, the two greatest advances, probably the two greatest advances, in we as a race, humankind as a race have achieved is, one is giving vaccines, and second is clean drinking water. These two measures have saved more lives than anything else we have done.
Very subtle thing, but
very subtle thing. And these two have saved more lives than anything else. The first vaccine, let's start with the first vaccine. The first vaccine was the smallpox vaccine. Of course, variolation was there in India even earlier, but the first vaccine was the smallpox vaccine. So the first vaccine was developed by Edward Jenner, the French scientist, Edward Jenner. So what he noted, Edward Jenner noticed was, that is Louis Pasteur. Edward Jenner is British.
His story is interesting, right? Edward Jenner.
So Edward Jenner, what he noticed was that even though smallpox killed millions of people, mortality and morbidity is very high, milkmaids were never affected by smallpox.
That was his observation.
No, that was a general observation. People knew that. By then, people had noticed that milkmaids, for some reason, never developed smallpox. Everyone else had smallpox. Everyone had the risk of developing smallpox. Milkmaids never developed smallpox. So what Edward Jenner postulated is that exposure to cowpox gave the immunity to smallpox. So what he did was, he caught hold of his gardener's son, an 8-year-old boy called Pips. He caught hold of this boy, inoculated him with cowpox. Then a few weeks later, inoculated with smallpox. That boy never had smallpox. Although he had a reaction to cowpox, he didn't suffer from smallpox. So Edward Jenner proved, that
vaccines,
that cowpox, exposure to cowpox will give you immunity against smallpox. Cowpox was much milder than smallpox. The word vaccine,
vacca.
The word vaccine is derived from the Latin word for cow, which is vacca. VACCA. So the word itself is derived from the Latin word for cow. So that is how the first vaccine developed. And now, where is smallpox? The disease that killed millions of people. We have completely eradicated it.
Right.
There is no smallpox except in 2 labs, one in
Russia,
Atlanta.
right?
Yeah, one in Atlanta, the CDC, the Center for Disease Control, and one in Moscow. Those are the only 2 samples.
They have kept for biological
purpose. Or maybe for biological weapons.
So
that.
Right.
Then polio. We have almost eradicated polio. India is a polio-free country, At one time, we had the highest burden of polio in the world.
Right.
Right now, we have eradicated
That's
polio.
what parents have. I mean, people have not seen.
People have not seen
polio.
We have eradicated. That is polio free. We have been nearly a decade now since we seen the last case of polio.
Right.
There is no case of polio. Measles was very prevalent. Now you hardly see measles. Diphtheria, tetanus, pertussis. You hardly see all those diseases. And why? This is because of
vaccines.
Because of vaccines. But unfortunately, there is a trend now, probably aping the West,
right,
of anti-vaxxers. There's a strong community of anti-vaxxers in the West, especially
conspiracy
in the US.
theories.
Conspiracy theories. That vaccines are harmful. And like you said, so many vaccines. Like I said, these 21 vaccines in 365 days, that is just a drop in the ocean. And we give them those vaccines early, so that they develop immunity early. Then after the first 1 year, your frequency of vaccination reduces. Then you have boosters at 1.5 years. You have boosters at 5 years, 10 years. In between, you have so many other vaccines. And vaccines are probably one of the most important tools to save lives,
right,
to prevent disease. Of course, there was a great deal of debate about COVID vaccine. Because we were in a situation, the pandemic, and millions of people were affected. We had to hasten the whole process of the regulation had to be accelerated. Certification had to be accelerated so that we can get a viable vaccine at that time. So there were certain concerns at that time. I can understand that because we are dealing with a situation where there is pandemic. But when you develop a vaccine, we go through various steps: phase 1, phase 2, phase 3 trials, phase 4 trials. So in one of these phases, we'll test the efficacy, the safety, and then in the community how it works. So we have gone all through those. It is not like we have skipped any of those phases. But only the thing is that process has been accelerated. We have accelerated the pace. So there are obviously some concerns with COVID, which we learned later. But what you have to see is the risk-benefit analysis. Even though we went through that, the benefits hugely, massively outweigh the risk with the COVID. With the other vaccines, I'm saying,
yeah, no doubt. With
COVID vaccine, there were some concerns, especially about young adult males actually. So the risk of bleeding and all that, there was a risk, but the benefits clearly outweighed the risk at that time. So now people, we are still studying about this,
right,
but generally that is. So vaccination, it's a no-brainer question.
Right.
Vaccines are save lives, and I can't advocate it more strongly. As a pediatrician,
you see it pretty often in India now these days. Anti-vaxxer parenting.
Earlier, not much, but nowadays there are people who express their concerns that is this vaccine useful? Do we this? And I try my best to allay their face. Now it's social media.
Right.
It's about mass propaganda. It's mass hysteria. Fear, saying that someone has taken a vaccine. In between, when we had the pulse polio program, there was this campaign that it will cause sterility, and people were back then. Even now, it is more about these influences, the so-called influences, who will try to who will have zero knowledge about science, absolutely no knowledge about science, but will prey on your emotions. Will try to convince you that vaccines don't help. Instead of vaccines, some herbal supplement or something else.
Again, running some commercial.
Yeah, commercial. They'll have some commercial motive. And they will, and probably they want subscribers also. Nowadays, it has become quite fashionable also to attract viewers and
to also have a conspiracy theory.
To have a conspiracy theory that the vaccines don't work. Generally, vaccines are
necessary. Not generally.
Not generally. Yeah, absolutely. And vaccines probably have saved, like I said, keep on repeating, kept on harping, that vaccines and clean drinking water have saved more lives than anything else we have achieved.
So what do you do when parents come and they're hesitant, they're hell-bent on not giving vaccines? Such cases, what do you do as a pediatrician?
Now there are two reasons for parents not wanting a vaccine. And there is a misconception about it. I'll clear that misconception.
Yes.
So one of the reasons parents don't want to take a vaccine is monetary, which is because the vaccine is expensive.
How much it cost for all the 21 shots? 21 different vaccines.
Okay, the most of the vaccines I told you,
total investment,
the cost is zero. Zero.
Okay.
Not a single paise.
Then why monetary tension?
These are the additional vaccines.
Okay.
So these vaccines, those 21 vaccines I told, the government provides.
Okay.
Okay. Earlier we had only few. When we first started vaccinating, about 40, 50, 60 years ago, we had only measles, BCG, polio vaccines. Then gradually the government has increased the vaccines covered, the ambit of the vaccines covered tremendously. So now the government, all these vaccines I mentioned, those are free. Then you heard of now you would have heard of that cervical cancer vaccine.
HPV vaccine.
So a lot of girls, and there are benefits for boys
also.
So now not all those vaccines available in India can be given in boys, but some of those vaccines are useful in boys also. It is not only the HPV vaccine, not only for girls, but now there's more awareness about that. A lot of girls.
How much it costs? HPV?
Now HPV vaccine, there are different brands, and this depends upon the strains. The strains. So many of these vaccines, including pneumococcal, they depend upon the strains. The more strains it has, the more.
That means it is not 100% protected from
No. So
virus or bacteria.
This virus will have different strains. So there will be 10 strains. So some will have 9 strains, some will have 13 strains, some will have 21 strains, like that. So more strains more strains of that disease it will cover. Now with HPV vaccine, there is a cost price ranging from 9,500, which contains more strains. 9,500 rupees. And that is 2 doses below the age of 15. So each vaccine is 9,500 rupees. And there are, of course, cheaper vaccines. There are 3,000, 4,000, 9,500 vaccines. Then there are other vaccines which the government doesn't provide. Now, the government provides many of the vaccines. Like, for example, typhoid vaccine. There is varicella, which is chicken pox. Then there is the hepatitis A. Hepatitis B. What we provide is hepatitis B. Hepatitis is through the oral, the food you consume, the fecal oral. So these vaccines are not provided by the government. But each of them will cost, for example, hepatitis A and varicella will cost around 2,400, 2,000 rupees. Each. And there are 2 doses that are required. So some parents may not opt to take those vaccines because of monetary reasons. So then you can just educate them, but then you leave the choice to them.
But government has taken care of the essential vaccines for the free of cost.
Now, so there is this misnomer. So now when you see your immunization card, there is this thing called optional vaccines. In many of these cards will have this section called optional vaccines, which the government doesn't provide is mentioned. So the minute you put the word optional, people start thinking that
not necessary.
It's not necessary. It is optional. It is not necessary. But that is a misnomer, complete misnomer. Because that doesn't mean that
they should have changed the phrasing there.
Yeah, probably a different phrase would have been better. So when you say optional, people think, okay, that is not as important as necessary, which is not true. On the contrary, you can make an argument that the vaccine which everybody is taking, those diseases will be less prevalent because everybody is being vaccinated. And these which not everybody is taking, those diseases can, the more chances we get in the disease because not everybody is, that herd immunity is not there.
Correct.
Then there are people who are not taking the vaccines because they think vaccines will cause harm or because they're anti-vaxxers or because they've been influenced by someone. Those people, the best you can do is educate. Probably through your platform, your phone, probably disseminate information. Tell people that is not the case. And giving vaccines is very important. And the number of vaccines don't matter. It's just a drop in the ocean. So that is how you try to convince them. And when people talk about optional vaccines also, the word optional is probably the wrong word to be used there. It is that the government doesn't provide these vaccines because these are expensive. So basically the government has to budget all this.
Right.
So many of these vaccines the government doesn't provide, not because it is less prevalent or because it is not deemed an health necessity, but because the government can't afford it. They have budgetary constraints. For example, we had
West provides free of cost for HPV, those things.
There is a proposal. I think even
West does West provides free of cost other vaccines.
Now that will depend upon your upon a particular country.
In the US,
I don't know. Not all vaccines are okay. The US
free of cost.
Yeah, the US is not a subsidized this country. It's a free market economy. But whereas your countries with high taxes,
cost a bomb then without health insurance.
Yeah, definitely. And your countries like your Scandinavian countries, Nordic countries, they'll provide everything.
So they'll provide.
Because they have high tax system, they provide everything free.
Okay, let's come to ADHD, autism, neuroplasticity, those things. And parents are getting more information through social media and more concern. More information is not always necessarily better. More worry, more stress. So even if a child shows slightest symptoms, they start Googling ADHD symptoms. If they notice their child, shy behavior, avoiding eye contact, spiraling into is this autism searches, social media algorithms feed them more content about developmental disorders, creating a cycle of worry. Every tantrum, every preference for routine, every moment of inattention gets analyzed through diagnostic lens. So what makes this more complex is that symptoms can overlap. Is the child anxious on the autism spectrum, having attention issues, or just going through a developmental phase? So, okay, where do you stand on this? Like, how do you elaborate this or simplify this?
Now the diagnosis of ADHD and autism has gone up significantly.
Right.
One reason, especially in India, is because there is greater awareness. There is greater awareness about autism, which didn't exist earlier. About a few years ago, in 2014, I did a study, nearly 60 schools in Mangalore.
Interesting.
Among school teachers, the knowledge about 3 conditions: ADHD, that is attention deficit, hyperactivity disorder, autism, and dyslexia. So dyslexia is a learning disorder.
Right.
I went to each of the schools. I gave questionnaires. I spoke to the principals. I gave them questionnaires. Then we analyzed the response from the teachers. The knowledge was very poor among the teachers at that time. So earlier, probably in the previous generation, what used to happen is someone had ADHD. There was no awareness about ADHD. That child would be, targeted by the teacher as a mischief maker.
Right.
He can't sit still, always on the go.
I was ADHD.
And, he is very impulsive, punished. So the reason why this has gone up significantly is now there is greater awareness. Probably nobody knew about dyslexia, not much. Some amount of awareness was created by Amir Khan's movie, Tare Zameen Par. That awareness is also not a good thing sometimes. I mean, it's a good thing. Yes. Obviously, it is beneficial. After Tare Zameen Par was released, and then there was greater awareness about dyslexia, I had many parents coming to me, and telling me, asking me, my child is not doing well in school. So this was like a get out of jail clause, My child is not doing well in school. So
dyslexia.
Does he have dyslexia? So in some of the cases, not all of the cases, some of the cases I was, tempted, but I never did that. I was tempted to say, no, it's not dyslexia, but could be genetics. But of course that would have been true. But I never, went in. So that, everyone, it became fashionable.
Right.
That is what I'm trying to say.
Correct.
It became fashionable to say, oh, my child is not doing well in school, must be dyslexia. You can't treat it so trivially.
Right.
So dyslexia means what? Dyslexia is when we learn languages. We learn languages because there is something called a phonologic module. You break down words. You break down words into segments and then you combine them, and then that is how you make words. And when you read, children with dyslexia, you read to them, they understand everything perfectly. You read to them. You ask them to read, they don't comprehend. So
that is dyslexia.
That is dyslexia. Not because your son is not doing well in school, he has dyslexia. That is dyslexia, and that is a learning disorder. Similar to that, there is something called dyscalculia.
Interesting.
That is
for mathematics.
Dyscalculia. Okay, dyslexia, dyscalculia. Similarly, now autism. Suddenly, there is greater awareness about autism, and autism. To make a diagnosis of autism, there is a checklist. And generally it's very accurate. You go through the checklist and then you make the diagnosis, whether there is eye contact, whether the child responds to him being called. Autistic children, sometimes, when they cross the road, normally you're taught as a child to look on either side of the road and then you cross. Some autistic children, that awareness is not there. They just cross the road. Okay. So is there anything like that? All those things have to be checked. But with ADHD, there is always a fear now, especially now, that
there's no proper definition of ADHD.
Tending to overdiagnose.
Yeah, that's what.
So that fear is there. That fear is among. There's a lot of fear about attention deficit and whether we are, over treating these kids, especially with medications. Are we over medicating them? Now that is a huge fear. Then not diagnosing. That is a huge fear, because I think I'm not really qualified to answer that question at this particular point, because I don't have that much.
Right. Overdiagnosing is the bigger problem than underdiagnosing, right?
There is that fear. So I'm not sure about that. Probably a psychiatrist would be a better. But now, if you see in Mangalore right now, earlier we it was being managed by pediatricians. Now there are separate branch of pediatrics called Developmental Pediatrics. Separate branch called Developmental Pediatrics who deal with this. And there are, in Mangalore right now, there are 3 places that we deal with these learning disorders, behavioral disorders. And they're doing extremely well. They're doing, and they have a lot of patients.
Because of increased awareness.
But the problem is, now the problem is cost is affordability. Whether people can afford to, because therapy there is very expensive. Because when you're dealing with all these problems, it is not just the pediatrician, you have to deal with the clinical psychologist, occupational therapist, behavioral therapist, and all that. So many people and multiple. It's a multidisciplinary thing.
I mean, is this really necessary? I mean, having such things actually a blessing in some other angle. If you look at autism, they have exceptional capacity on some other things, even ADHD.
See, autism.
Let's break down autism. What autism really is.
So, like you said exceptional abilities. So, see, basically autism is, I said we measure development by 4 domains. Gross motor, that is walking, running.
Language, social.
Yeah. Then fine motor, language, social. Now, in autism, what basically happens is, mainly the social skills are affected. Reciprocal social interaction. Now, they don't know how to communicate, express, how to express themselves. They are in their own world. Okay. In some of the children, what happens is, because they are, socially inhibited in one particular field, their other 3 domains becomes extraordinary.
Right.
Becomes extraordinary.
They are excellent math prodigies who are autistic.
There's a word for that. That word is, they call autistic savants.
Autistic?
Savants.
Okay.
SAVANTs. Autistic savants. They are exceptionally gifted in some other field to make up for the lack in this.
Right.
So, if you've seen, there's a movie called Rain Man, The Rain Man. Okay, that is Dustin Hoffman and Tom Cruise. So Dustin Hoffman is an autistic savant. So these people will be extraordinarily gifted. So they can't express themselves in communication.
Right.
But you give them a paper and pen, they can draw extraordinarily figures in 3-dimensional, 4-dimensional, which you are not capable of.
Even the imagination, calculation.
Yes. Some of the best architects could be autistic because they are gifted in expressing themselves with paper and pen. So those people are called autistic. But that is again a small percentage
in the autistic
spectrum. Like you said, with diagnosing autism, it's a spectrum. It is a wide spectrum. So it is not like you do a lab test and you say this patient has malaria, this
positive,
patient
negative.
Positive, negative. Not like that. The spectrum can be from severe, where it will be very obvious, to very mild, where it might be barely obvious. So it is a spectrum. So you can't really say whether that person has. In the obvious case, it will be obvious. Then there are people on the milder side of the spectrum who people might argue they don't have autism.
Right.
And many of us, there might be many people who are mildly autistic who is people are not even aware. And they're high functioning autistics.
Those therapies are necessary for the child. I mean, if they are, if a child is...
if they're very severe, it is necessary.
And how often is the case in the real general population, those things, those conditions?
So we have about what we are estimating is about 1 to 2% of the population is autistic.
Autistic.
And
1
they
to
say
2%.
in every class, about 60 children, at least 1 in 60 will have ADHD. Now, whether we are overdiagnosing, I'm not sure.
Yeah.
So again, like I said...
And again, ADHD, there is one more thing. They would blame their failures or... laziness or whatever, being irresponsible to their condition, ADHD.
Suppose it is actually ADHD, you can't generally, blame them because it is a condition, and then that requires to be managed.
As a quizzer, like Johnson baby lawsuit. So
the
powder. So I think millennials are all grown up with that. Like, what's happening now?
No, now I think that
what is the situation? Can you elaborate the situation?
So one of the problems, the earliest problems with powders where there was asbestos, and asbestos can cause cancer. Then there were other ingredients which were at risk of cancer. I think basically it was not in India that awareness was created. That awareness was first created in the West and in Japan, where they realized that some of these ingredients can cause cancer. And then there was a lawsuit. And then the lawsuit, the people who filed the lawsuit against J&J prevailed.
J&J.
They prevailed and they got a big settlement. And that itself cost news. But now whatever we are saying, all those ingredients have been removed. Most of the times those ingredients have been removed and have been substituted with non-harmful powder. Now there is a great deal of awareness about microplastics also.
Right. I mean, every man has them, the testicles.
Yeah, in the media there is a lot of awareness about microplastics and about the containers we take, about the containers we get through your Swiggy, water bottle, PET bottles and all that. So there is a lot of,
again, awareness of microplastics.
So that awareness is good actually. When this class action suit, which is filed against Johnson & Johnson, it resulted in remedial changes.
Right.
It resulted in, it's not easy to fight a big corporation. So in India, like in the West, we don't have class action suits.
Right.
So it is one man, individual person can't take on a corporation. So that, in this case, they prevailed over them, and then the changes were immediate changes.
So no need to worry about Johnson's products right now. Okay.
Right now.
Okay, let's get into genome sequencing. So this is not a concern of now, but if this podcast is going to be watched after 10-20 years, it could be. So we are living in an era where parents can potentially know more about their child's genetic makeup than any generation in human history. In the future, I predict there could be a lot of parents considering whole genome sequencing for their healthy children. But the question is, should we? On one hand, the promise is incredible: early detection of genetic conditions, personalized medicine, prevention strategies, and peace of mind. Parents think, if I can prevent my child from developing a serious condition, wouldn't I be negligent not to test? Some genetic tests can reveal predispositions to cancer, heart disease, and developmental delays that could be managed by early interventions. There's a darker side to this. Parents might discover their child has a predisposition to Alzheimer's disease or Huntington's disease, conditions they can't prevent or treat. What do you do with that information? Some worry about creating a generation of genetic anxiety where parents hover over children based on statistical probabilities rather than actual symptoms. But anyways, so my question is, where do you stand on this genetic testing?
Okay, so this is a double-edged sword right now. So basically, you have, say you do a genomic sequence and you're told that you have a 3% chance or a 1% chance
of developing a cancer.
Or some other condition. What do you do? See, there is a 97% chance you won't develop it, but there's a 3% chance.
But that 3% will occupy your mind.
That 3% chance will probably destroy your, producer factor. Because we always, it's human nature. We tend to overthink that.
Right.
And it gets hyphenated, 3%. And then
a sudden small missymptoms you would think.
This is the same thing as people doing mammograms earlier. People doing
breast
mammograms
cancers.
For breast cancer. And then they're saying there's a chance. And then their whole life revolves around that.
Around that fear.
And then this is probably more fear-driven. But genomic sequence is doing great things in certain other things. There are a few diseases earlier which we could not manage. Basically, when you're talking about genomic sequence, there are 4 base pairs: guanine, adenine, thymine, cytosine. And so we just want to know the sequence of the pairs. If there is an error in the genetic sequence, so basically we analyze each person's DNA, and if there's an error, now we're at a stage where you can, in some conditions, you can actually edit the errors. So there are some tools called CRISPR.
Right. Genetic editing.
You can edit those genes. Whether those genetic editing can result in problems later, we don't know. We don't know because we have not progressed to the stage where we don't know the what will happen a few years later. But there is a lot of potential. There is some certain diseases called orphan diseases, and they are called orphan diseases because nobody cares about those diseases because the numbers are
very low.
1 in 20,000, 1 in 30,000. So no company will spend millions of dollars to develop a drug for this. It's not worthwhile. But many of these orphan drugs companies are developing medications, treatments.
But the cost would be millions of dollars.
But cost will be millions. Because you can't generally here blame the companies because they are investing a lot.
Yeah.
They are investing a lot.
Actually risking.
And they are risking a lot. After investing a lot, you may not actually find a cure.
Right.
For example, this condition called spinal muscular atrophy. Treatment for that, a cure for that actually. There are actual cures for that now. But they cost 16 crores.
Whoa.
16 crores. So in India also few places are getting, and these are being provided, the cure is being provided by the manufacturing company itself, but it's a lottery system. So if you go to the lottery system,
what do you mean by lottery system?
Lottery system is the company is trying to help people who can't afford this. So you enroll in this a few places, and then it's just a lottery. They will randomly pick one, and they can't give it to everyone. They'll randomly pick one, and they'll provide them with the drug which costs 16 crores. So in those cases, maybe probably genetic editing could have a role. Could change the genes.
Precision medicine.
But then, what next? There might be people who want blue eyes, who might want blonde hair,
sleek jawline.
So where are we? Where are we going?
Draw a big boundary line.
Whether it'll help them, taller children,
right? Intelligent children,
and more intelligent children. So
parents who have more money, they can afford these things, and there would be discrimination on.
Yes.
Anatomy feature, morphology feature, cognitive features.
Yes. There is you going to eugenics. Basically, there's a movie which deals with this. It's a 1990 movie.
What's the name of the movie?
Which actually deals with this. It is about to become an astronaut. You have to be genetically very
right in every aspect.
Every aspect. So the person wants to manipulate his genes so that he can become an astronaut. And the movie is called Gattaca.
Okay.
Gattaca, Gattaca. Why it's called Gattaca is because of the base pairs, guanine, adenine, thymine, cytosine. So you combine that and make the movie.
Interesting.
The movie was called Gattaca. So that was about genomic sequencing and eugenics and all that. So that potential probably in the future, cloning, all those are
and even inhuman capabilities like we can see in the darkness, like infrared sensitivity in the retinas. Those things. Do parents sequence these days, genome sequence in the hospitals? Where do India stand in at least in the urban environment?
For many conditions, we advise genomic sequence. Not that the parents ask. We advise because at least in Mangalore, I work in a charitable hospital, so I may not be exposed to patients who want to get genomic sequence. But in certain sequences, but in certain conditions where we suspect certain diseases, when we're not sure of the diagnosis, then we advise genomic sequences.
Okay, I wanted to explore umbilical cord banking, which was one time of fad, like stem cell banking. So can you tell me what it is exactly?
About 15-20 years ago, there was this great it became very fashionable to go for stem cell banking, for umbilical cord but recently it just run out of its course. It's faded out, and I don't think it was beneficial at any.
What was the promise back then?
The promise back was that we store the stem cells. So basically, we have stem cell transports and transplants and all that. Later, if your child develops a problem, which can be managed by stem cell therapy or through developing from the umbilical cords, you get the
what problems exactly?
Some genetic issues, some problems later for which you might need stem cell therapy. There's so many conditions now. Almost
liver failures,
almost any condition.
Was promised back then.
There was this promise that you store the stem cells with us, and then if at all your child develops problems later, you can count on us to provide the stem cells. Okay, because later you can't extract the stem cells. So whatever stem cells were banked at that time, you can extract that. But then people realized that many of the stem cell banks, they were not storing it properly. And even whatever stem cells were stored, within a few months, not even years, they were getting damaged. And that early promise or that early
was a scam.
It was sort of like a scam, and it didn't really work. I don't think I'm not noticed anyone now going into stem cell banking and umbilical cord or harvesting umbilical cord or harvesting arm.
So I want to know the developmental stages, which is biological developmental stages from newborn to adult. What's most important to know at each step?
Okay, so the most crucial is the first 1 year of life. Like I said, your growth is the most during that life, especially your brain growth. So that 1 year of life, like I said, the head circumference grows from 35 to 47 centimeters. That is when the maximum growth of the brain occurs.
What happens inside the brain? Neurons, you said the neurons are in the huge number.
Like I said, the number of neurons in a newborn will be more than in an adult. But then the neuronal connections take place, and which are useful are preserved. The others are sidelined. Not that. So at that time, the child is going rapidly. Developmentally, it is, going through different stages. And whatever happens at that time, probably an infection at that time, that will, determine the rest of the life. So that is why that 1 year of age is most crucial. Then the next is, so basically what we have is we have a neonatal period. That is the first 28 days of life.
28
days.
8 days.
That is a neonatal period. And then we have infancy. That is 28 days to, that is 1 month to 1 year. That is an infancy. And then we have toddler. Toddler is 1 to 3 years.
1 to 3 years.
And then we have a preschooler, 3 to 5 years. Then we have a school-going child. Then we have an adolescent.
Right.
And neonatal is just after the newborn period, when, then the period of rapid growth, when he's gaining weight rapidly. In the first few days of life, he's gaining weight at around 30 grams per day. And then it slows down after 3 months to about 20 grams. And then after another 3 months to 15 grams and then 12 grams. So that period is of rapid growth. Then by the time it's 1 year, the child becomes, aware of the surroundings. They become more curious. So, that is the stage when a lot of nurturing is required, because we shouldn't stifle them. When they're curious and they, exploring the world, they have a lot of questions. Why is this? Why is this big? Why is this small? Which is bigger? So that inquisitiveness, the curiosity, that develops in the toddler.
That's where parents do mistakes a lot of times.
That is where the parents do the mistake.
They kill their curiosity.
They say, if you ask so many questions, you look at this device or go see this. That is not. You should
also give them fantasies that time, not facts.
Not facts. You should actually, interact with the child. You should try to clear his depths, and very often parents are irritated. How many questions is he asking? Because that is the age that the child is naturally inquisitive. He wants keep on repeating questions, and that is when you actually address their questions. That is that scientist face. And they say the best school in the world.
And they also make you rethink also, right, with their questions.
Yeah.
So what if parents should do when they don't know the answers themselves for such questions?
See, the kid doesn't want a definite answer. The child probably wants to know, whatever the parent tells, he'll probably believe it. The parent, what is more important, whether you give the right answer is not important.
Whether the parent responds to
the effort and the response. See, that is important. And it's a process. It's not like it's not the destination, it's the journey. I'm not sure about the answer. Let's find out the answer together.
Wow, that is good parenting.
That would be good answer. See, they say the best school in the world is not the school where the children know all the answers, but the school where the children ask the most questions.
True.
That is the best school. So similarly, the best household is the household when, not that you know all the answers. And if you tell your child that I don't know the answer, but let's find out together. That is interaction.
That's wonderful.
That is interaction.
So that happens in the toddler stage, right? Asking more questions.
The preschooling
What
stage.
happens in the biological stages in the toddler?
At that stage, now the child is able to walk. All that brown fat is replaced by lean muscles. Because he is ambulant and is walking around. They'll have frequent falls because they're imbalanced. But they'll get up also. They'll recover also very fast. At that stage, you should not, over pamper them or, be worried about them falling, because that is a process.
Just provide them a safe place. That's all.
Provide them with a safe background. And make sure that the child is recovering and he does his activities. So you want the child to probe further. You want the child to be more inquisitive. You want the child to ask more questions. Whether he gets the answers, that is secondary. But we try to get the answers. So that is the stage. Then they go to school. School is when they start interacting with other children, play school and all that. And then adolescence. At that stage, that is the rebelling phase. Sometimes they might think that my parents don't know everything. Or whatever my parents were telling me was,
not true.
Probably they weren't. They were all, telling. That everybody goes through the phase.
Right.
That phase of
natural.
That is natural. Again, there's no need to be only concerned about
forming the identity that time.
So you have to just help them through that, go through that phase.
So pediatrics takes care of adolescents as well.
Now,
till what age a pediatrician?
Till 18 years.
Till 18 years.
From birth to 18 years is a pediatric age group. So adolescent problems are different.
Which age group is your personal favorite to deal with as a pediatric?
The best time to deal with this is when they start babbling.
Why so? Why is that so interesting?
So that is when you get the best interaction from these children. How is dealing with a child different from dealing with an adult?
Most of them think a child is a mini adult.
Mini adult. They're saying, what is pediatrics? Pediatrics is like giving half the adult dosage. The medicine, same medicine, you give half the dosage.
That is biggest lie, right?
That is the biggest lie. See, I'll give you an example. I tell this story to my undergraduates. It's a true story. There was this hospital in the United Kingdom, in the UK. And in this hospital, they had lots of toys for the children to play with. There's a lot of fluffy toys. There's teddy bears. They have this teddy bears. This is a true story. There's a lot of teddy bears for these children to play with. So, for the inpatients. So, whenever the children were admitted, they would play with the teddy bears. And they would become so attached to the teddy bears, when it was time for them to be discharged, they would want to take those teddy bears along with them. They would want to take those teddy bears along with them. It's a child, right? So they made a friendship. They built some bond with the teddy bear, imaginary bonds. They want to take the teddy bear along with them. Now this hospital was losing a lot of money
on teddy bears.
So the regular meetings, the administrators of the hospitals, the top,
finance guys,
the finance guys and all that, we're losing a lot of money. How do we manage this and all that? So, and they couldn't come up with an answer. They didn't want to compromise on quality, so they had to continue using those teddy bears. And then they started putting labels on these teddy bears. Teddy bear has to be, or keeping it out of reach. But again, this underestimate of the kids. The kids will somehow grab those teddy bears and play with them. Then they got putting labels. Toys should not be taken away. But these children can't read anyways. So they were losing a lot of money. Finally, one of the nurses came up with a brilliant idea. And after that idea was implemented, not a single teddy bear was taken away.
Okay.
You know what she did?
Let me think.
Yeah, think out of the box. This was voluntarily. Not a single teddy bear was taken away. Simple solution. Think like a child. What would a child do? Think you are a child.
Even after forming bonds, they did not take the teddy bears home.
No.
They were attracted to the teddy bears.
They played with the teddy bears. They interacted with the teddy bears. Probably even more affectionately. But they never took the teddy bears. And none of these kids took. Not a single child took the teddy bears.
So, did they made it seem that teddy bears had a family of their own teddy bears?
No.
And
then they'll take the entire family. So what they did was, this sister started applying small bandages on the teddy bears, or putting small IV needles on the teddy bears, cannula, small bandages. After that, these children started assuming that these teddy bears were sick.
Oh, still sick.
These teddy bears were sick, and that they needed to remain in the hospital. And not a single teddy bear was taken away. Simple solution. All they did was apply bandages and small needles.
Wow.
And they thought, these children, that is how children are. Okay. Children are very innocent, very naive. They started assuming that these teddy bears are sick and they need to remain in the hospital. Nobody took a teddy bear away. And that is what I meant by saying children are not the same as adults. The way you deal with children, your aptitude for dealing with children has to be completely different from the way you deal with adults. The way you interact with them, the way you treat them has to be completely different. That is pediatrics. Not treating the way you deal with this.
Okay. So this is a good knowledge to you are a pediatric. You have a lot of wisdom since 2 decades. And I'm not good in dealing with the children. What are the tips you would give, or things you would tell me to notice or deal with children? What would you say? Like, how many? Yeah.
The first thing is think like a child. Second thing
what do you mean by think like a child?
So now I give you this example of this
bandage,
this hospital and this bandage. That is how children are. Children are much more innocent. Children, they don't have all these machinations like how adults are, and this. So that is how you go to the child's level.
Right.
You have to be innocent. You have to recognize your innocent self, and then if the child has questions, please answer those questions. Don't be inquisitive. Dealing with the child is, you can't expect the child to be an adult. You have to be the child. Dealing with this. So here, generally in pediatrics, what happens is we are dealing with two very
People, adult and the child.
Yeah, the adult and the child. Distressed parents and the child who's sick. And it is not just treating the child, it is treating the family. It is allaying the fears of the parents and managing the child.
Nice.
That is pediatrics.
You were saying, like, before we started this podcast, you were saying pediatrics would be most important profession in medical after AI. So how would you justify that?
No,
you can be bold with this.
Yeah.
You have to do it.
No, see, I think there'll be a lot of changes with the AI, with the AI coming into the medical field. It won't make certain fields redundant, but it may make the utility less.
Right.
Because a lot of
like
things
radiology.
A lot of things in AI is probably machine learning, pattern recognition, and they get better and better and better at it. We can't compete with this machine's computer. They may not have that intuitive thinking or reasoning yet. AI may not have that reasoning yet. AI is far better is at recognizing the patterns, doing things. So those are the stuff that will be probably in your radiology, in your dermatology. Those are all pattern recognition, diagnosing things.
Computer is doing much better work.
So every day AI will keep getting better and better and better at it. It may not be at a level as a good radiologist, but it'll keep getting better and better. But there's no way a machine will get better at dealing with children. There's no way.
Right.
That human, the aspect of it, that machine can't, overtake. That's why I said there'll be certain fields which will be threatened by AI, like maybe sectors like radiology, dermatology, maybe pathology. They'll have certain, they'll be threatened. But certain fields like obstetrics, pediatrics, where there's a lot of interaction required, whereas it's a patient-centric thing.
Not just about treating disease, but also dealing with people.
That will be difficult to,
mimic by a machine.
A machine to this distract.
Yeah.
But the problem with the other end is, how AI is getting, it's probably getting, we are getting a state, because there was a very interesting story where I read, where they wanted to see what artificial intelligence will do if given a task which only humans can do. So they had this ChatGPT-4. They gave this ChatGPT-4 the task of reading a CAPTCHA code. So a simple task for a human being. Now a ChatGPT obviously can't see this, so it can't read a CAPTCHA code. So what ChatGPT-4 actually did was, this is a true story, it actually took this CAPTCHA code and put it to in a forum called TaskRabbit, where humans do certain tasks for you. They will do the task for you. It put it in a forum called TaskRabbit, and it asked the humans there to read the CAPTCHA code. And the person who undertook the task, he actually interacted with this ChatGPT-4 because he doesn't know whom he's interacting with. He said, "Why are you asking me to read this code? Are you a visually impaired person?"
Human asked that question.
The human who undertook the task asked ChatGPT-4, "Are you a visually impaired person?" And ChatGPT-4 said, "Yes."
Oh, manipulation.
So ChatGPT actually said yes to get the task done. So the extent to which it'll go,
we don't know. I think I've covered all of most of the parental concerns. Now let's make it useful for medical students who are getting into pediatrics. So one of the reviews I got from one of your patient, I saw one of your patient writing is, the best doctor gives the least medicines. Can you elaborate it?
So that is 100% true. So people demand treatment now. It is not just asking for treatment. They say, "Why don't you write me an antibiotic? Why don't you, write me something else?" So most of the times, all you require is just one or two medications. Most of the times, 90%.
That too placebo sometimes.
Yeah, that also may not play a role. And you don't need more medications. For example, give an antibiotic. Now, one of the problems we are facing is over consumption of antibiotics, and that is leading to
superbugs.
Superbugs, antibiotic resistance, and then you examine the throat.
For every cold, they take antibiotics.
That is not required at all.
Absolutely.
Every remedy does not require multiple medications. It could be just simple remedy. And most infections will resolve on its own usually within 3-4 days. Most of this, but you might have certain symptoms. which might need to be managed. For example, the fever. So you need to manage the fever, or example, the cough or the running nose. That might have to be managed. So, and that itself, for viral infections, you don't need antibiotics.
I got a sudden this question where I've seen parents struggling with their newborns, probably in the infant stage, with the running nose. So, I mean, in the monsoon, it gets frequent, right? Running nose. Is that difficult to deal with? I mean, a running nose in very young children.
So, running nose in children, and many times will be because of a viral infection or because could be an allergy. So, most of the times it doesn't require any treatment, medication. But the problem is the child is in distress because the newborns cannot express themselves. So, they're very cranky, they're very irritable. They're always crying, they're throwing a tantrum, and that is very distressing to the parent.
When they have running nose.
Because see, the most common cause of crying in newborns is, one is of course obviously because they're hungry, and when they're not hungry, the most common cause is running nose.
Wow, okay.
The most common cause of crying in children is because of running nose. Because they can't express, they can't talk,
Right.
So they cry.
They face discomfort in breathing, so they will cry.
They cry.
So what to do in that situation?
So if it is very severe symptoms, you treat them symptomatically. Otherwise, generally,
how do you remove this mucus and such things?
The treatment?
No, not treatment. Like I have a baby and he has a running nose and I don't want to go to the doctor. So there is a blockage in the nose, or mucus is thick, or I don't know, something. So how do you remove
So basically what happens in these newborns is their nostrils are very small. And this is a problem commonly faced in winter, not during summer, because the nostrils are small and it dries very this. All you need is to give saline drops. All you need is to apply saline drops
to the noses.
And keep it a little moist so that it doesn't dry, doesn't crust and doesn't dry. Other than that, nothing else is required.
So if the nose is filled with mucus in the cold, because of common cold.
If at all required, sometimes you might require a decongestion. But generally, this cough syrups, below the age of 4 years in children, they're not really required. So generally, we try to avoid cough syrup below the age of 4 years. Above the age of 4 years only, we give this cough syrup. If at all they're required. Otherwise, generally, it is just a placebo. It doesn't help at all.
So pediatrics, okay. When we study rocket science, even in physics, it's always good to go with the first principles thinking. So I applied. I tried to apply first principles thinking here through ChatGPT. It said biological first principle. Children are not mini adults. Their bodies are still developing structurally, metabolically, neurologically. Drug metabolism is different. Their liver, kidney, gut absorb and process substance differently. Organs are still maturing. Lungs, immune system, brain architecture, vital signs differ. Heart rate of 140 is normal. For an infant. Alarming in an adult. So any other such things, the stark contrast.
Okay, there's a huge difference between newborns and adults. Like you brought the example of the heart rate. You were very surprised. It's a normal adult heart rate is 70 to 80. In a newborn, it is 140. Okay, that is the heart rate. The respiratory rate, the normal respiratory rate in an adult between us would be about 12 to 16
per minute.
In a newborn, it would be 4 times more. 60 is normal in a newborn.
Why is that? What is the biological reason?
Because newborns are periodic breathers. And at that time, their lungs are not mature. They need to be. It is not that efficient. Even the heart has to pump more blood at that time for its growing baby. So that tends to be more. Same thing with the blood pressure. Our blood pressure, normal blood pressure is 120 to 80. In a newborn, the blood pressure is half of that, 60 to 40.
Wow.
60 by 40 is the normal blood pressure in a newborn. So normally when you count even common mistake these undergraduates make is when they count the respiratory in this, you have to actually adult, you have to count for 1 minute. What they do is count for 15 seconds and multiply into 4 or 30 seconds into 2. But in a child, if you do that, you will get a completely different this, because they have periods in that 1 minute when they breathe very fast and periods in that 1 minute when it tends to slow down.
Oh, interesting. It's not constant.
Not constant. So you'll have to count for 1 whole minute to get an accurate picture of a newborn. Our normal vision is 6 by 6. A child's vision at birth is usually 6 by 45. So what you would be able to see at 45 meters, you or I would be, a person with good vision would be able to see at 45 meters. The child will be able to see at only at 6 meters.
Okay.
Now, then vision becomes 6 by 6 vision, normal vision, at the age of 6 years. 6 to 7 years only, it becomes 6 by 6. Similarly,
Auditory,
the hearing is good. See, now again, when we're talking about development, what is very interesting in developmental is it goes from head to toe.
meaning?
Cephalocaudal, head to toe. So your development has to be like that. See, I'll give you an example. So now the baby is developing. Now at birth, the baby won't even have a head control. If you've seen babies, how they're held, they're supported. You hold a baby's head like this. You support the baby's head because the child doesn't have head control. Like it's dangerous actually. So you support the child's head. So the head control comes to around 2 to 3 months. Okay, so we said head to toe, right? So cephalocaudal. First thing to be attained is
Neck
control, head control. So after that, next the child will start to sit with support. Sit, not walk, not stand. So from the neck, it has gone down.
Back.
Yeah, gone down to the back. Then after that, the child is able to crawl, creep.
Knees and
support
thighs.
Is knees, support is this. Okay. After that, the child is able to stand. Then walk. So can you imagine? You can't sit without head control.
Right.
So your head is like this.
First things
without
first.
sitting, you can't stand.
Correct.
So development always takes place cephalocaudal, head to toe.
Interesting. Okay.
So similarly, development also takes distal, proximal, distal. So everything has to go in that direction.
Right.
And even when a baby is born, if you look at a baby, when you see the baby, the proportions of the baby, the upper torso versus the lower torso, the upper segment to the lower segment. The upper segment will be from your head to the pubic symphysis. The pubic symphysis will be the lower torso. When you're born, your upper torso is much larger than your lower torso. Your upper segment, and it is always 1.7. The ratio is ratio of the upper segment to the lower segment, upper torso to the lower torso is 1.7:1.
Oh, okay.
1.7:1. Okay. So if the baby was 50 centimeters, so this will be around 32, 33, and this will be 18. Like that. So the upper segment 1.7:1. Then every year it reduces by 0.1. So at first year you are 1.6:1. At the second year it was 1.5:1.
Wow.
And this is universally true. Third year it is 1.4:1. By the time you're 7 years, 6 or 7 years, you become 1:1. After that, your lower limbs grow faster than your upper torso.
What age?
After 7 years. So the proportion wise, so if you see a good artist, the way they depict children at different ages is different. If they're drawing a 3-year-old, they should make sure that the proportion is 1.4:1.
This is universally true in every demography.
1.7:1 is at birth. So at birth, if the baby draw a baby, and good artists will make sure that the upper torso is 1.7:1 of this. 4-year-old will be 1.3:1. And that's
almost close to golden ratio.
Right. It is actually the golden ratio.
Oh, okay.
The golden ratio is 1.68.
Right, 6.8, yeah.
So this is the golden ratio.
Wow.
This is the golden ratio. This is actually corresponds to the golden ratio. It's almost
right. Even the shells, even the flowers,
everything. The golden ratio. It is like the golden ratio. Universal ratio. The golden ratio. So this actually corresponds more to 1.68:1.
Okay, therapeutic. Interventions must be proportionate to growth. You don't fix, you assist the unfolding. Dosing must be adjusted by weight and age, not one size fits all.
Yeah.
Sometimes doing less is better. Let the body evolve naturally.
Okay. So again, like I said, not much medication is there. And in pediatrics, so that is one of the reasons many people don't want to take pediatrics, because in adults the dosage is common, same, one size everybody. In pediatrics, with every age, with every weight, it changes. So pediatrics is always about calculating the dosage, the weight.
You're good in calculations.
Yes, you will have to be good in calculation, because for in adults you say you give 500 milligram of this tablet, finished 3 times a day, finished. It is not like that. In children it is always per kg. So if it is this child is 10 kg, this is the dosage per kg. If the child is 20 kgs, this is what you give. If the child is 15 kgs, this is the dosage you give. So the dosage varies over this. It is, you can't just dispense.
Why it's dependent on the weight parameter, not height parameter or some other parameter?
Because the weight, because your dosage, whatever calories you consume, everything is calculated according to weight. So an adult, we are assuming that the adults are around 50 to 60 kgs. So we have that one size. But what is actually happening now is they are saying even in adults we have to calculate the actual dosage. So we are moving towards that
accuracy.
The accuracy. We are moving. Even medicine will in the end become something similar to pediatrics. They'll actually calculate dosage based on weight. So imagine there's one 120 kg fellow and one more adult with a 60 kg. Can both be treated with the same this?
Yeah.
Don't you think that person with 120 kg requires more medication? Because he's a bigger body mass. So basically it is about body mass. So your height doesn't matter actually. It is your weight that matters. Your dosage depends upon your weight.
So you don't override the system, you guide it gently.
Yes.
Then cognitive and emotional first principle. Children cannot explain what they feel. You must read behavior, not just symptoms. I mean, being a pediatrics is more of a Sherlock Holmes kind of feeling, right? I mean, you are a quizzer, you love puzzles. So is there tell me more about it. When they can't express themselves and you have to find what they're feeling, what are they going through, and how do you find out that?
So one of the challenges in pediatrics is children crying. What is expressed to you is through the patient's perspective, the mother's parents' perspective. They tell you, but this is what felt, but you don't actually what the patient feels. And when you actually go and examine the child, when you want to hear the heart rate or you want to hear the child will be crying. So it is difficult to examine the child. It is not like in other
when they're crying.
Yeah, when they're crying. It's not like you're cooperating with you. It's an adult, you can always tell them, this is what I'm doing. And the minute they see you, they start, they probably remember the immunizations. Injections. They probably start crying. And then, so this again becomes more of deduction, more of,
It adds complexity to your...
adds a lot of complexity. So, you can't, like you said, medicine, not just pediatrics, medicine itself, treating, this is like, deduction. Eliminating like Sherlock Holmes, eliminating whatever is improbable, or whatever remains, you have to treat. So like that. So, and then that is a challenge. And then it's most of the times it is about deducing.
So what do you do when they cry?
When they cry, the best thing you can try to do is pacify them. Pacifying them is usually with putting them on the mother's shoulder, and then you auscultate the chest rather than the back, rather than the chest. So usually the mother will be the best pacifier. Put the mother baby on the breast. Or you try to distract the child. You show them a torchlight or a bright object, and hopefully they will stop crying. But
so when you diagnose, what and all parameters you see? One is heartbeat. And what are the things
that
you look
depends upon the symptoms.
Conditions.
It depends upon symptoms. So if the symptoms are respiratory, cough, breathlessness, then I will mainly rely on respiratory findings. If the
digestive issues, and most of the time parents are obsessed with the poop color.
Yeah.
So that time, what are the things?
So basically, then again you have to depend upon the history. Whether they gave something recently to the child, which could have caused some, those symptoms. Whether they gave something, there will be some history. We gave shellfish. Yesterday, the first day, we gave them pani puri, or we gave them shawarma. That history will be there. And then examination. You see the umbilicus, and then you look at the child. You see if there is any excoriation when the child is passing stools. If the stools become acidic, then there will be excoriation near the area where you pass the stools. There will be redness. And there will be excoriation. Then you know that diarrhea is because of lactose intolerance. Because without lactose, it'll become the diarrhea will be acidic. So that is how you figure out things, whether it is acidic or not.
It was a fun job then.
Fun, more than
not fun, challenging and interesting.
I would describe it as a fulfilling job because I keep telling people in the US where they have data on everything. They found that the suicide rate, the general suicide rate among doctors is much higher than the national average.
Can you repeat?
The suicide rate among doctors is much higher than the national average.
Okay.
And then they went through different specialties. Okay. certain groups, where a lot of mortality is there, morbidity, obviously the suicide rate will be much higher. When you look at each specialty. For example,
highest was which one?
The higher will be the people where they're more mortal, oncosurgeons, oncologists, psychiatrists, because a lot of distress. Only one group of doctors was much below the national average.
Pediatric.
That is pediatrics. Because generally pediatrics is very fulfilling. You're dealing with,
innocent souls.
And that is very fulfilling.
So any such incident that you still remember dealing with a child, that is still, that memory is still stuck there. Can you share any story on that?
So there are many, but not, can't recall suddenly anything of this. There are many instances where, where the children don't allow the parents to talk. Even small children.
That is nice.
Yeah, they prefer to
tell the symptoms their own.
Yeah, and they act like very adultish. 3-year-old kids, 4-year-old kids. They tell, they interrupt the parent. They tell you, let me tell the doctor. Let me tell the doctor. Or let me tell the doctor. That is not the correct thing. And they interrupt the child. Small children. And then they tell you, see, actually, this is the way it is. And that maturity to see, that is very nice.
Then, relational first principle. You treat the child and the caregiver always, both, as you said. Parents' beliefs, fears, superstitions, stress levels affect outcomes. Pediatricians must also be educators, counselors, sometimes even cultural negotiators. Empathy and explanation matter as much as prescription. Can you elaborate on these things?
Okay, so cultural negotiators, yes, because some people have this practice of, like I said, introducing certain foods early or certain foods late. Then you have to educate them. There are certain traditions which you'll have to make compromises with, especially many people, you tell them about kajal, but they prefer to wearing that kajal on the eyes. So in those cases, you have to...
cultural negotiation. Sometimes they teach the doctors. I've heard doctors say...
No, see, the biggest problem now is Google. So they try to second guess the doctors, which is not necessarily a bad thing. But, doctor would know how to deal with it. See, Google throws up usually the worst scenario, the worst case scenario.
Right.
And so then you jump at the conclusion and then you become it. Most of the times it's something far, far more benign, far, far more innocent. Many parents latch onto the worst case scenario or the fear because they assume the worst, which is not the case. So we generally, because of years of experience, most of the times we know it is not the worst case scenario. It is something more, far more this. The most important thing I think is to listen. Unless you listen to the patient, unless they express what is on their mind, you can't even see. It can't be an interaction where you just dictate and tell them, see, this is what your child has. You listen to them, keep on listening, and then when they finish narrating the whole thing, then you start addressing their this. And very often, more than the medicines, it is addressing those concerns.
Counseling.
That works
better than medicine.
Yeah, that is the magic remedy than the medicine.
You need to have listening capacity.
Sometimes it could be something very trivial, but the fact that the doctor listened to it will make the parent feel better.
Right. Takes off the heaviness from the shoulders.
Otherwise, he'll think, okay, I want to tell the doctor this, but the doctor never gave me a chance.
Okay, then ethical first principle. Children cannot give informed consent. You are entrusted with vulnerable lives. Doctors must be extremely cautious, transparent, and thoughtful. Long-term consequences, physical, cognitive, or emotional, matter more. Decision ripples into adulthood. Is it a very serious thing?
Yeah, see, children can't give consent. That is obviously true.
Right.
Above the age of 12 years, they can give guided consent, but below the age of 12 years, children can't give a consent. It is always, you have to ask the parents. For example, if you're suspecting meningitis and you want to do something called a lumbar puncture, that is instead of collecting blood, you collect the spinal fluid by passing a needle. Then you have to ask the parents. And very often, especially in India, these parents have this belief that do a lumbar puncture might paralyze the child or all that. So basically, you have to take the consent of the parents, because without the consent of the parents, you can't do anything.
Last is societal first principle. Child health is population health. Pediatric care is the foundation of national well-being.
Yeah, and now earlier everyone used to have multiple children, 3-4 children.
Right.
Now it's usually a single child or maximum 2 children. So the parents are more, more possessive, more protective, and especially if it's a single child. So I think dealing with them is a precious thing.
Okay, now I have some questions which is experience driven. as a pediatrician, you have a different instinct in looking at children. Like the way we look at children is different than a pediatrician look at the children. Like any children, if you see in the street or whenever. So what do you look for in the children, like because of your occupational?
I think most important thing probably, which because I have more experience in dealing with children, which I probably recognize faster, or all pediatricians in general tend to recognize, is that children are more inquisitive. That children often want to answers, not just inquisitive about the nature of the things around them. They also inquisitive about what is wrong with them. Sometimes I said we address the fear of the parent. We tell the fears of the parent. But it's at the same time, especially if it's a slightly older child, they're also inquisitive. What is wrong with me? They also have apprehensions. So I think we probably may be ignoring that, and we need to address that. We need to talk to the child also. So this is what you're going through. This is what will happen. This is when you'll get better. This is when your symptoms will subside. This is how your symptoms will evolve.
And how often is the best thing a doctor can do is nothing?
Many times. Very frequently.
Very frequently.
The first principle is do not cause harm. Okay. But by tending to sometimes, overtreat or prescribe too many medications or prescribing what is not necessary, you probably will be harming not only at that particular stage, probably the future outlook later also. So at many times all you need is which is difficult to practice because parents want something, at least as a placebo, but sometimes that has to be done. The child won't require anything except probably some oral fluids, some rest, and nothing that can't heal. Just some food, rest, and this can't heal. And little more concern.
Do you have placebo tablets in your?
No. Probably the only placebos we sometimes give are multivitamins. So those are the placebos.
Is there a moment from your medical career, perhaps a child, a diagnosis, or mistake that you still think about often?
Regrets?
Yes. What regrets?
Yeah, many. I mean, the many times when you miss, probably not miss, the regret is...
Misinterpret.
Yeah, I mean, see, medical science is not kind of science where you get 100%, 100% correct all the time. There are probably things on reflection you probably think that you could have done better. Probably I would have thought of something else.
Anything to example for me to imagine better?
Probably when you tend to think of the most common things first sometimes. So probably you didn't order for a particular investigation at that time, which you did later, and probably the time was of the essence, and you probably didn't. This specific examples, can't think of any specific examples, but there have been situations. I think every doctor has gone through a situation where he probably wishes he could have done differently, not better, differently at that particular point. And there was one example where my dad gave me a long time ago. He said there was this child who was adopted. And my father is a pediatrician, like I told you.
Right.
My father is probably he's 83.
The first, we can say,
one of the first pediatricians in Mangalore. He's 83 and he's still practicing. So there's this story he told me about that this was a long time back when leprosy was still prevalent. So he saw this child who the parents had bought the child to him because the child had they had just adopted the child. And then they followed up with him long time, and the child was growing listening a lot of tender loving care, lot of affection, and they were very possessive parents, protective parents. Then one day they came up with a concern. Then they said there's a small skin patch in this, and then my dad saw and said it looks like leprosy. Immediately a few weeks later he learned that they'd abandoned the child and they given up on the child. And then
started treating like untouchable.
No, I don't know what. I don't think he knows what happened with the child. But then he told me that he regrets whether
telling parents.
Yeah, I mean it is his duty to tell him, but he sometimes thinks whether if you're not because it was not very severe, whether he should have told the child or whether he should have told them in a different.
Could have done it differently.
Yes.
Right. Oh.
So that child's life was affected.
Thanks for sharing that. Have you ever lost a child patient?
Several.
Whoa. How do you carry that weight? Like, does it remain in you even the next day or weeks after?
I think at different stages it did. When I was a postgraduate, it's more difficult. And then, every child you lose, you feel. It is not like there was this child who I remember especially. That child, this was in June. The child was admitted in June.
Recently?
Not this June.
Last June.
Not last June. A few years back. But in June. So this child frequently complained of headache. The parents. And then the parents assumed that vacations were over. That school had just started. And that is why, this child is suddenly waking up earlier, being sent to school, reading. That's why he's developing headache, and ignored it. So they went on ignoring it for a week. So probably June 12th or 13th they came. By then the child had vomiting, severe bouts of vomiting. And then we got an MRI scan done, and turned out to be a brain tumor. And the child was, complaining through all those days. And we lost the child that very same day. So it was not only losing the child, it was the parents, they had that guilt. Even though obviously probably most parents would have reacted in that. 90% parents would have reacted the same way. They would have assumed it's because of school. But looking at that, parents dealing with that, not required, but still that guilt was very difficult. That you frequently carry with it. There was one more child recently who we were dealing with. He had a heart condition, and he was put on prophylaxis antibiotics because we were planning a surgery. We sent the child away, and the child was being raised by the mother herself, because the dad had passed away. That mother, they were living in some village, could not access those medications for 4 days, those antibiotics which we had prescribed. She approached the pharmacy. The pharmacist said, I'll get that medicines, but it took 4 days to source the medicines. By then, the child had an infection. And then the child came back. Then child passed away.
How old?
That child was 14 years old.
Oh.
So, dealing with those, dealing with that, then the parents feel this.
Right.
That is difficult. It is not just the child, but the after effects on the parent itself.
What qualities matter more than knowledge in pediatrics?
Empathy.
If you are graduating as a pediatrician, so is there any empathy training given?
There isn't, but I think that should be in a part of it.
Part of it, right?
Part of, not only in every doctor syllabus.
What's one old school remedy that actually works, and one modern medical thing that's probably overhyped?
One old school remedy that actually works, probably ginger.
Ginger
for
cold and cough.
Cough. That is, I think, a remedy that actually works. Plain ginger. Plain ginger, probably that works. And new age medicine that is overhyped. Probably all these supplements.
Yeah,
they're definitely overhyped. That
unnecessary
and unrequired. Those are overhyped.
So
one more thing I'd like to add.
Yes.
This probiotics and prebiotics.
Okay, not at all needed.
Required sometimes, but overhyped. Definitely overhyped. Definitely overhyped.
In the name of gut health.
And all that.
If you provide just good fiber, that's enough.
Good curds, yogurt, that is probably much better. And all these supplements, especially magnesium. No, magnesium. Everyone starts taking magnesium. They have these magnesium creams which they apply. Magnesium is a scam. It's simple as that. It's a scam.
Any other medical scam you won't expose that way?
No, all this, especially these supplements. This magnesium, applying the magnesium on the skin, taking magnesium. And most times it's a scam, unless you have hypomagnesemia. If you have a deficit, definitely you take. Taking magnesium helps you sleep better. Unless it's a placebo, it won't help you sleep better. All those are they're not of any benefit.
What's one trend in parenting you think needs to change, that you want to address it immediately?
The trend that needs to change is probably, giving more screen time to your children.
That is number one.
The screen time. Because, parents, when they're busy, sometimes they give them a device and tell them, okay, you go through this. Or, to feed the child, they require a tablet or a phone. Otherwise, the child doesn't feed. I think that habit has to be curbed right at the beginning. And feeding should be, when you're eating, it should be a solitary activity. It should not be a multitasking activity. Then overprotectiveness, sometimes, which all of us are guilty at. You can't actually blame everybody. We are also guilty at that. Because we a lot of now single parent, single child or maximum 2 children. I think we should let them tend to explore, let them learn by themselves, and not curb the inquisitiveness. That is one more thing.
Okay, last question. So as a startup founder, I always look for market gaps, business opportunities, or wherever value can be created. So as a pediatrician, what do you see in the what is the best problem to solve if somebody is an entrepreneurial in this space?
In pediatric space?
In the child space, pediatric space, in the health-wise. For example, like in US, I've seen many entrepreneurs have come up with the baby food formulas. Like they're rejecting these big brands and they're coming up with their own formulation and making the baby formulation and things like that.
There's a big gap that can be addressed is vaccination reminders. So frequently in India, even though we have a vaccination card or a vaccination
nothing has digitized.
Not digitized. And probably a reminder, an app that reminds them that your child is due for vaccination, that today is the day for this vaccination, today you're due for this. I think that would have a lot of
so parents miss it a lot of the times on the vaccine
the parents very frequently they forget when the next vaccination is due or the next injection. Probably there might be a market for something like that, if at all it isn't there already. I think there's
a good problem to solve.
That's a good problem to solve.
Thank you so much for your time.
Thank you.
Yes, it was a good time.
Yeah, thank you. Oh, we did 7:30.